Thank you. All right, good morning, everyone, and welcome to the Vancouver City Council meeting of Tuesday, October the 7th already, 2025. Now, this meeting is being held in person and by electronic means. Council members and the public may participate by either method. Any members joining electronically are reminded to enable video to confirm quorum. This meeting is being live streamed on the city's website and YouTube, and meeting progress will be updated regularly on X at Van City Clerk. Now, I do want to acknowledge that we're hosting today's council meeting on the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations, and I do want to thank them for their generosity and their hospitality and the loving care they show this great land that we live, work, and play on. I also want to recognize the incredible contributions of all of our teammates across the city of Vancouver who choose to work to make this place a way better place. It's been incredible to see you in action. And so with that, can we please have roll call?
Mayor Simon, the chair. Councillor Kirby-Young. Councillor Dominato. Present. Councillor Bly.
Present.
Councillor Fry. Councillor Montague.
Present.
Councillor Klassen has a leave of absence all day for personal reasons. Councillor Meisner.
Present.
Councillor Zhou. Councillor Orr. And Councillor Maloney. You have quorum, Mayor Sim.
Great, thank you very much. So the plan for today, we're going to break at noon for lunch, followed by the in-camera meeting, return at 3 p.m. to continue to deal with the remainder of the agenda. If needed, recess at 5 p.m. for a dinner break and reconvene at 6 p.m. to complete the agenda. In camera, council is required to meet in camera later this week. The reasons and authority under the Vancouver Charter are listed in the agenda. Would someone like to move a motion to move into in camera? Councillor Dominato, thank you. Seconded. Councillor Kirby-Young, thank you. All those in favor say yay. All those opposed say nay. Great, the motion carries unanimously. Minutes. Minutes one are from the nomination subcommittee meeting on September the 9th, 2025. Are there any corrections to the minutes? Would someone like to move adoption? Councillor Kirby-Young, seconded by Councillor Meisner. All those in favor say yay. All those opposed say nay. Great, the motion carries unanimously. Minutes 2 are from the Special Council Business License Hearing on September the 10th, 2025. Are there any corrections? Someone like to move? Great, Councillor Dominato, I think that was Councillor Meisner that seconded. All those in favor say yay. All those opposed say nay. Great, the motion carries unanimously. Minutes 3 are from the council meeting on September the 16th, 2025. Are there any corrections to the minutes? Would someone like to move? Great, Councillor Kirby-Young, I think Councillor Zhou seconded first. All those in favor say yay. All those opposed say nay. Great, the motion carries unanimously. Minutes 4 from the public hearing on September the 16th, 2025. Are there any corrections to the minutes? Would someone like to move? Councillor Meisner, seconded by Councillor Zhou. Thank you. All those in favor say yay. All those opposed say nay. Great, the motion carries unanimously. Minutes 5 are from the council meeting following the Standing Committee on Policy and Strategic Priorities on September the 17th, 2025. Are there any corrections to the minutes? Would someone like to move? Great, Councillor Dominato, seconded by Councillor Montague. All those in favor say yay. All those opposed say nay. Great, the motion carries unanimously. Minutes 6 are from the Auditor General Committee on September the 18th, 2025. Are there any corrections to the minutes? Great. Would someone like to move? Councillor Zhou, seconded by Councillor Montague. All those in favor say yay. All those opposed say nay. Great. The motion carries unanimously. And finally, minutes 7 are from the public hearing on September the 18th, 2025. Are there any corrections to the minutes? Would someone like to move? Councillor Meisner, seconded by Councillor Dominato. All those in favor say yay. All those opposed say nay. Great, the motion carries unanimously. Matters adopted on consent. Council will now consider matters adopted on consent. We have reports 1 through 4. Noting report 1 has a presentation with representatives from Vancouver Coastal Health and referral reports. Well, there are a lot of R's today. 1 through 3 on the consent agenda for council's consideration. Council may adopt the recommendations for reports 1 through 4 and referral reports 1 through 3 on consent. Does any member wish to hold any of these items for debate and discussion? And Councillor Dominato.
Thanks, Mayor. Yes, for report 1, the urgent mental health and substance use, I'd like to see the presentation, and I'd like to hold report 2 for further questions. That's the
Thank you very
Kitsilano
much.
secondary synthetic turf. Thank you.
Thank you very much. Councillor Kirby-Young.
Yeah, thanks, Mayor. I'd like to hold report 3 for question. And I have a clarification question on referral report 3, so I guess we'll have to hold that in order to do that, right?
So, sorry, I couldn't hear. So you're holding report 3, and then you have questions on referral report 3. Is that correct?
Correct. Yeah. Thank you.
Thank you. Seeing no one else on the queue, before we consider the consent agenda, if anyone believes that they have a conflict of interest, now is the time to declare it. Would anybody like to declare a conflict? No? Okay. So let me do the math here.
Mayor, can I just raise a point of order? I'm just wondering if the clerks could close the blinds because I'm getting blasted by the beautiful sun, which I normally love. But
Yeah, no, it's October. We're not supposed to have sun here. What's going on?
I don't have my sunglasses on, so thank you.
Thank you very much. All right. Let's see. So we have. Okay, so if I got this correct, we have report number 4 and refer reports 1 and 2 for the consent approval. Would someone like to move adoption of the recommendations before council contained in the reports? Councillor Dominato, seconded by Councillor Joe. All those in favor say yay. All those opposed say nay. Great, the motion carries unanimously. So the following have been approved on consent. So report number 4, Auditor General Committee Recommendations Transmittal Report, and refer report number 1, CD-1 rezoning 2090 West 1st Avenue, and number 2, CD-1 rezoning 6486 Chester Street. Report 1 has a presentation with representatives from Vancouver Coastal Health. Should council wish to vary the order of the agenda to hear report 1 before unfinished business 1, we need a mover. Great. Councillor Maloney, seconded by Councillor Blythe. Thank you very much. Okay. So let me just work. Okay. So we're going to jump to report number 1.
Mayor, point of procedure. You had a mover and a seconder, but I don't believe we voted.
Oh, we didn't vote. Sorry. I was jumping ahead there. I was so excited. Okay. Any discussion? No. Okay. So all those in favor of varying the agenda say yay. Okay. All those opposed say nay. Great. That motion carries unanimously, and we're going to vary the agenda. So now the first thing we're going to do is we're going to cover report number 1, Urgent Mental Health and Substance Use Service Enhancements Program 2025 update. Now, before we begin this agenda item, if anyone believes that they have a conflict of interest, now is the time to declare it. Seeing no one there, we will go through a presentation. We have team members here to present this item. So please go ahead.
So you have to join. My apologies, Mayor and Council. Would just be a moment. We didn't anticipate the agenda modification.
you like a few more moments? We're good. No pressure. Last minute change evidently. It's all good. Take your time.
Good morning, Mayor and Council, and thank you for accommodating those moments as we got ourselves up and running. My name is Margaret Whitkins. I am the General Manager for Arts, Culture, and Community Services. Oh, here we are. Good morning, Margaret Whitkins, General Manager for Arts, Culture, and Community Services. And on behalf of ACCS, we're pleased to be here today with partners from Vancouver Coastal Health to present a 2025 update on the Urgent Mental Health and Substance Use Services Enhancement Framework. The Urgent MHSU framework and programming arises from Council's 2022 motion directing staff to allocate $8 million a year to enable the requisition and hiring of mental health nurses. In early 2023, VCH created the Urgent Mental Health and Substance Use Services Enhancement Framework. The city endorsed this initiative, and VCH has since implemented and been delivering this program, providing for expansion of the police health partnership programs and non-police health-led crisis response resources. I am pleased to invite Caitlin Etherington, Operations Director from Vancouver Coastal Health, to provide Council with the 2025 update on program implementation. Thank you.
Good morning. Margaret did a great job introducing what I'm here to present about, so I'm going to dive right in. But before I do, I just want to acknowledge that we do our work on traditional and unceded lands of the Coast Salish, including the Musqueam, the Squamish, and the Tsleil-Waututh. So the next 33 slides are going to look a little bit like this. We're going to have an overview of the framework that guides all of this work. And kind of brings it all together just to ground us in what we were setting out to do. We're going to get into some more detailed program-specific updates. You're going to hear from me as well as my colleague Robert Bush, who is leading all the police partnership programs. So he'll come up and give those updates, and then back to me for a bit of a summary of the third-party evaluation that we've done with on some of these teams. So back to that moment in 2022, now I can't remember if it's 2022 or 2023 when we put the framework together, we articulated some early goals. I just want to review those before we get into the rest of the framework to ground us. So we knew that we wanted to increase capacity of the system to respond in a safe and health-focused way to people in crisis or approaching crisis. So we knew that would mean introducing some non-police crisis response teams to really enable new parts of the continuum that were health-focused. We wanted to provide additional approved services for earlier de-escalation, as well as to the people in crisis and the people in the city who are supporting those people who are most likely to be in crisis. So we knew we wanted to provide those supports and work really in close partnership with housing operators, shelter providers, other social service providers in the city. And we had a commitment to really think about how we were serving our Indigenous clients and ensure that our responses to Indigenous clients in mental health crisis were based in culture. So this is the implementation timeline. Let's move this up so I can stand up straight. So Margaret went over the motion that went forward in 2022, at the end of 2022, and then we came up with this framework. We worked in partnership with the City of Vancouver and with the VPD to come up with the framework itself, and then we started implementing. So right out of the gates, and I'm not going to go into these programs and exactly what they are now because that's the lion's share of the rest of the deck. But just to give you a sense of what the last couple of years has looked like in terms of implementation, right out of the gate, we put some VCH nurses into the Operation Command Center of the VPD. That's the program we now refer to as the OCCLN. That came about of June of that year. Later on, towards the end of the year, we launched our first non-police crisis response team, which is called the Mobile Crisis De-Escalation Team, and we refer to as MODE. Later on, the next month, we were able to kind of officially launch the doubling of the capacity of the CAR program. That was late 2023. And then the Indigenous Crisis Response Team, which was the development of that team was led by the Vancouver Coastal Health Indigenous Health Team, and they did a lot of engagement with Indigenous service providers. And so that team didn't get launched until the following summer and has now had, a full year of operations, which we're excited to tell you about. We also did an evaluation, I've already alluded to, of just the MODE team and the CAR team, and we're looking forward to an evaluation next year that will be Indigenous-led of that Indigenous-focused team. So we wanted to right off the bat share some of the things that we're excited about in terms of outputs from the last year. So we've served through these additional services, we've served over 8,000 individuals in the city of Vancouver in 2025. Just a little taste of that with the Indigenous Crisis Response Team. They've just in the months between April and June, they've supported 57 really complex Indigenous clients with about 550 visits with those clients. Gives you a taste of what that team, the type of work that team's been doing. The mobile de-escalation team expanded to 7 days a week earlier this year in the spring, which really allowed us to increase the follow-up that we're able to do and the support we're able to provide the system on the weekends when there's not a lot of teams operating. In terms of just general overall community safety, to give you a sneak peek, part of our evaluation, we surveyed community service providers who are using these services, and 63% of those respondents reported feeling safer with the CAR 8788's increased capacity. 70% of those agencies said that MODE strengthened their own capacity to respond to crisis. So we're seeing some really good early feedback when we're talking to community about these new services. And then just in terms of the system, we're seeing MODE reduce emergency department visits by almost 40% after the intervention when we're looking at those mental health related emergency department visits. We're hearing from the Indigenous Crisis Response Team about the work that they're doing, helping people stay in hospital, helping their Indigenous clients stay in hospital to receive the full treatment they need and not leaving against medical advice. And then we're just seeing a general diversion, which we'll walk you through, that was in our original goals of when it's not necessary, diverting people away from a police response and to a health-led response. So recruitment, this is just, we try to always do an update on where we are with recruitment. So the first note I want to make about this slide, so this shows all the full-time equivalent positions that we endeavored to hire with this framework and how they relate to the various different teams. The first note I'll make about this is that we never, with our original framework and now, we've never endeavored to just hire nurses. All of the FTE associated with the CAR and the OCCLN are nursing positions, but the non-police crisis response teams take a team-based approach where we have a variety of different clinicians that we'll tell you about further in the presentation. Those green 9 FTE left are the remaining positions that we are trying to fill still. They're all related to the mobile de-escalation team. As I've spoken to you about before, that's a very specific skill set that we're hiring for that position. We need people with certain experience, certain skills, certain years of experience in order to respond to crisis in a way that continues to make the community feel safer after they support them. So we're being quite intentional about who we hire for that team, and it's taking us a little bit of time to get there, but we feel very confident in the approach of the right people over the maximum amount of people. I also just want to point out that 50 number, so right now with that $8 million grant, the 50 FTE, that has fluctuated over the 3 years that I've been here reporting about this program. And that's because particularly for the new teams, as they set out with an original mandate, and then they go into the community and do the work, and then they learn about more and more about what that work is. And we've evolved the staff complement of these teams to fit what the work is. And so because of that and to fit within the funding envelope, it's now sitting quite comfortably at 50. And then the last point, and those are all the points I wanted to make about this slide. I'm sure there'll be questions, happy to answer them. Okay, so now we're going to get into some of the program-specific updates. So first off, I'm going to talk about the mobile de-escalation team. And I'll just touch on the triangle on the slide there is really talking about risk profile of any particular crisis. So if there is an imminent risk of threat and you need a very fast response, it continues to be a 911 call. The other teams, particularly the ones at the bottom there, the non-police crisis response teams, are not responding when there's an obvious risk to the safety of the clinicians that we have responding. So 911 is always part of this continuum, but we're trying to create different options in our system so that we can divert to those other teams when appropriate. So mode specifically is a 7-day-a-week service. It's same day. And it's receiving all of its referrals from those supported housing operators, shelter operators, and other social service operators. They are showing up that first visit, it's always with a nurse and one of the other workers, so a social worker or a care coordinator. And then depending what's going on with that client, either the care coordinator then can do some of the follow-up with that client, or they might want to call a physician. Perhaps that client is so unwell they might need to be apprehended, and that's when we'd involve a physician. And then we're doing multiple follow-up calls and trying to connect that person who's probably fallen through the cracks of our system to the right supports. So these are kind of the highlights from the last year. That sun coming on me. We've expanded to 7 days a week. We're really focused on recruitment still. We've been trying to hone our referral and intervention data so that we can report back to tables like this and others on what the team is actually doing. And we've expanded the access pathways, so we're working really closely with libraries and all of the kind of security personnel at the libraries. We've done lots of meet and greets and sessions with, and we're currently in conversation with 3 of the community policing centers so that those CPCs can make referrals over to MODE as well. And the idea there is to be a link between businesses and BIAs through the community policing centers over to the MODE team. So trying to still limit access so we're getting the right calls about the right amount of people and not flooding our intake offices with referrals, but trying to make it as broad as possible so that we are kind of as available to the public as we can be. Okay, so this is the blue bars are looking at last year, 2024, and the orange bars are looking at 2025 to date. So we've averaged these out for this year because we're obviously not done it yet. And you can just see an uptick in the number of unique clients we're supporting every month, in the number of active referrals that are coming to us every month, and then the biggest uptake in the percent of referrals that are actually resulting in an outreach visit. So everybody that calls the MODE intake line, we're working really hard to support. But they might already be connected to another team in the system, and we don't want to then get involved in their care and disrupt that kind of therapeutic relationship. So a lot of the time we're just calling that other team, we're calling that support service, and we're saying, your client's in crisis, can you go and help? If they can go help that same day, we'll leave it to them. If they can't because of their own caseload, whatever it is, then we'll do an outreach visit. But we want as many of our referrals as possible to be in that orange bar, and we're heading in that direction. These are a large part of what I said before. So if you think about the referrals coming into us are people who aren't connected into the system. And if we think about those people maybe falling through the cracks of some of the existing mandates, what MODE's really doing is trying to really get to know that client, build a relationship with them, and plug them into the right place in the system, which really involves collecting a lot of collateral about who that person is and what's going on for them and why they need help, and then connecting them over to that service. So we're seeing a big increase in the number of referrals that we're making to the rest of the system from our team. And where are they referring people to in the system? So you'll see the big green bar, about 50% of our referrals are over to other mental health and substance use community teams that VCH runs. So we're saying to those teams, this person is unwell, they're gonna have a hard time making it there. We're gonna walk them over there. We're gonna, really have this warm handover and make sure that that transition happens well. We're also referring people to primary care teams, which also have mental health and substance use supports embedded in them. We're referring to the Access and Assessment Center, which is, those would be like lower acuity calls that this person needs help, but it's probably not a crisis, so we're going to refer them over to our main intake. And then on the other end, some of those calls are going to CAR 8788, where we're looking at the risk profile and saying this is more appropriate for a police response. Moving on to the Indigenous Crisis Response Team. So this team, as I mentioned before, was created by our Indigenous Health Department. It's the first Indigenous-specific crisis response service developed by a regional health authority in British Columbia. It's very innovative in its approach. It's one of our only Indigenous-specific teams, and has really, as you'll see in the next couple of slides, approached the idea of crisis response in a way that's really grounded in culture. So this has been their first full year of operations, 2025. They've had really positive early feedback from community. They've worked really hard on strengthening those partnerships with Indigenous serving organizations and looking forward to a more fulsome evaluation in 2026. This slide is really trying to point to this work they've been doing of understanding crisis response as an Indigenous-specific team. So they're really seeing crisis as the result of disconnection from culture, disconnection from community, and they're working to reconnect the clients that they serve in a really meaningful way. And most of the team are either Indigenous or people of color, and they're working with these clients in a clinical way, but also in this way that's really steeped in culture. And they see their work as very circular rather than linear and not just clinical. You see some of the other, on the left-hand side, there's some other descriptions of how they approach the work and how it's different from the work that MODE does. And then on the right-hand side, you see some of their data. So they really only kind of crystallized their data collection in March, and so we have from April to July for this team. And the blue bar there is the number of new clients that are being referred to ICRT every month. And then the orange bar is the number of follow-up calls. So what we're learning from this team is that they're supporting clients longer than the MODE team would be, because they're really prioritizing that relationship and that warm handover with the rest of the system. So they do work very closely together. They're co-located teams, but they approach the work differently in a really complementary way. Now you get to stop hearing from me. I'm going to pass over to my colleague Robert to speak about the police partnership programs.
Morning, everybody. Thank you. So I'm going to pick it up with our police embedded program. So CAR 8788 has been around since the early 70s, and of course has a reputation. We've had people coming from all over North America to visit and do drive-alongs with our car. So the point of the CAR 87 is that we're pairing a clinician with a constable, and they're being deployed to, thank you so much. They're being deployed to intervene in an urgent situation. So the officer and the clinician form a team that are going out in the car. But in addition to that, we have clinicians in the back office who are gathering collateral information to inform what the team is going to be encountering in the community. So the individual, so as was mentioned, the car doubled its capacity in December of 2023. And the purpose, we'll move to the next slide. Oh, okay, great, thank you. Okay, so we've really focused on sustaining the expanded capacity. So we have 4 cars on the road. The shifts run, the car is on the road from 7 until 11. And between noon and 6 o'clock, we have overlapping shifts. So we actually have 4 cars on the road at one time. And as I mentioned, really the car is being deployed to a crisis call that's either coming from one of the, the OCC, or it could come through our Access and Assessment Center, or it could come just directly to the call, CAR program. We have a number specifically for the shelters and for some of the other partners that we work with who call directly. In this particular, we're talking about implementing education, interagency education. And this has come out of the review that was conducted throughout last year. We actually recognize that there's an opportunity and a necessity to make sure that we're keeping our staff and everybody safe when they're deployed. So things as having a nurse side by side with an officer. And if things start to go sideways, we want to be able to have the nurse know how to conduct themselves, be able to use the radio to call for help and that sort of thing, as well as really education around better understanding mental health presentation. Okay, so this data is looking at the last 3 years, and what we're seeing, total clients served, we're seeing a definite progression, and although we don't have the complete data for this year, 2025, we're definitely on track to surpass previous years. The nature of the car, so we're looking at the volumes of the car going out on outreach. So the first colored box there, assessments attempted. So with the Mental Health Act, when a form is issued to actually find someone, to bring them to the hospital, or if they're we would get those calls from the hospital from various sources, and the car would be deployed to try to find the individual and to do an assessment. So in that first category of 3,500 individuals, this is the number of people who we've actually are looking for and making contact with. So we may not have found them, but we're repeatedly looking for those individuals. The next box in orange, the clients who we've located, assessed, and left to their own care. With this group of individuals, the call may have come in as there's a disturbance, a store owner or a shelter may have called, and we've located the person. We want to actually have a discussion with them, assess them, and then left to their in that situation. There was no reason to take any further action. And then the final category are clients assessed and hospitalized. Clearly, that's exactly what we want to do, find people when they're in distress and get them to the right care. To the next slide. What we're seeing in this pie chart from last year to this year, we're seeing an increase in community referrals, which is excellent. And of course, this is only a portion of this year, so we are anticipating this is going to far exceed what we've seen in the past. The orange, which are referrals coming directly from the police, is a really interesting one because we anticipate that that's going to continue to decrease because of the work of the OCC. So in other words, we're resolving calls that would normally come from the police earlier on in the system and getting people connected to the right place. The green is as families. So in this situation, we would have someone may call and say, my loved one's in the basement, they're acting very suspicious and we want to. So we would come and do a assessment on that. When we look at the acute, obviously, if there is someone who has left the hospital, we'd be looking to find them as well. So moving on to the Operation Command Center liaison nurse. This was a new initiative where we had, we placed a clinician right in the Operation Command Center to be better able to assess the referrals that are coming from the call board. So the challenge, of course, and we're happy to say we are fully staffed in this category, but the challenge for this service is we require really skilled individuals who have a long history of working with a mental health population. So we're happy to say we're fully staffed. This program only is not 24/7. It's only until 11 o'clock. But what we're seeing is that so we're seeing a high volume of individuals. So we're reviewing files, and I want to be careful here. I'm hesitating because we often say calls, but that's not exactly correct because the volume of calls we're actually reviewing cases that the police have already, the command center has already assessed. So we get a portion of those individual referrals coming down from the larger group. So we see that there's 3,365 individuals. This is a new service, so we have a dashboard that we initiated early on, and that we're trying to separate the various components so that we can track the data and the service. So that dashboard is still under review, but I'm going to make some reference to it in the next slide. So going there. So here's what we're seeing. So out of the total calls of 650 service calls that come into the police, there's a segment of approximately 60 individual calls that get referred to the OCC liaison nurse, and they're having a deeper dive into those calls. The 60 calls are further broken down to 50, and that's when we actually have a shift. We have nurses on at that time. And then the 10 calls are when we actually overnight, we don't have staff. So those 10 calls would remain on the board, and then the next day they would be reviewed to see if there's something that the team would need to do. So out of those 650, we're assessing 60. Out of those 60, we're intervening immediately with the 50. And then the breakdown. So what we're trying to do is divert primarily. So the first 10 are clearly, we've done an in-depth review. We've actually determined that it makes sense to deploy the car or connect the person to their mental health team. So those are calls that an officer, a patrol car would not have to attend to. The second 10 are individuals where there's definitely a mental health concern, but the nature of the call is of such a risk, there's such risk associated with it, that we're actually reverting that call back to the VPD to intervene. So those would be perhaps a suicide, or there's concern around weapons. And then finally, the last component is where having a nurse as part of this team, consulting with the officers of the Operation Command Center is a really advantageous, because we get questions around things that are presenting an officer may be encountering, and they just need to share that. And really, so we're going to a call, there may be a presentation of mental health. Do you know this person? Is there something we should be aware of? So those are the nature of the consultation calls. And then in addition to that, there's chronic callers. So there may be someone who calls every day saying that they're suicidal. Everybody knows about them. They've been calling this. So those are the nature of the types of calls that would fit into that category. So this is presenting similar data. So well-being checks are clearly a big component of what the team is involved in. Missing persons, so following up on those calls. Suicide is an interesting one. I just want to underscore, if it's a person calling about suicide, the police have to be involved. So we will be involved, but it's really an urgent call at that point. The next item is information requests. As I mentioned, there may be an officer, patrol car interacting with somebody, and they may need some additional information, either health information around how the person is presenting, or it could mean information around how to connect the person to a community service. And then other is everything that's not included in the previous categories. Finally, calls that are diverted to a healthcare response. And I think it underpins the importance of having a clinician at the OCC. It's really matching the level of need with the resource, the appropriate resource. So what we're seeing here is calls that get resolved. So the referral comes in, the clinician notes that the individual is already connected to one of our teams. They will contact the team to say, could you get your case manager to reach out to your client? So those ones get resolved pretty quickly. Diverted to client for community teams. So that's where the second category is. So in the first one, the OCC may have talked through the person and been able to connect them to some other thing, and then diverted to a community non-MHS resource. So it may be directing them to CMHA or one of the other partner agencies. And then, of course, we would look at referrals to the car from the OCC, so deploying the car.
Okay, so as part of our grant application, we all decided it would be a good idea to do an evaluation of these teams as we were investing in them, wanting to know what the impact was. And so we, together with the VPD and the city staff, we did a RFP for a third-party evaluator, and they spent the better part of 2024 interviewing clients, interviewing referring partners, interviewing staff, and looking at some data. And that evaluation was completed in January 2025. We presented it to our steering committee in the spring and shared it through a memo with you all in June. And it will be soon publicly available as attached to that memo on the city website so that anybody can read it. It's a very long read, very interesting. We've put some highlights here for you just to give you a sense of some of the successes we saw, as well as what we saw as really important recommendations for us to focus on and what we've done with those recommendations. So in terms of community impact, when we were speaking to non-VCH community agencies, so these are the nonprofit operators in the community, and talked to them about their interactions with MODE, we heard that, and I just want to underline that this was MODE's first year of operation. So they were kind of a baby team last year, finding their way. And I'd love to be able to redo this survey. But at the time, 40% of those we talked to said MODE made them feel safer when they responded, and 70% that MODE helped them to build their awareness, skills, and knowledge in terms of crisis response and the system and how to support people in crisis. The CAR program, 63% of those respondents said that the CAR and their response made them feel safer, and 95% reported feeling really confident of knowing when to call the CAR. In terms of the health system impact, we shared a little bit of this, but just highlighting a little bit more. For the emergency department visits, dropped by about 40% after a MODE intervention for clients. And then the connection to primary care or community mental health teams increased by 25 and 30% after that intervention. So that's that work of finding this client who might be falling through the cracks, supporting, and then connecting them back to the appropriate community team, which is where we want to see this population. For the CAR, we see a big increase following their intervention, and that's because really, as you just heard from Robert, half of what that team is doing is connecting people to hospital. So you see this increase in emergency room visits right after the intervention from the CAR, and then you also see the connections over to primary care and community mental health teams. 8788 doesn't have the staff to do as much of that kind of connecting to community services, but they have been able to do way more of it with this influx of services, and we see that represented there. Again, diverting away from police response as a system, we see that in the months following the MODE intervention, those clients have a reduced rate of referral to the CAR program. So again, we're diverting away from the police partnership program over to the health-only response. And then the CAR clients, we see their decrease in interactions with police after their intervention, which is higher, obviously, in the month right after. And then even 6 months later, we still see a 20% reduction in the amount of police interactions. In terms of the areas of improvement that were identified in the report, there were pieces around community awareness. Does everybody know about these teams? They were very new teams. There was some work to be done there, and to clarify both what's different about the teams and what their scope is. So these teams still operate within the Mental Health Act. People still have the right to refuse care. You know, these are not silver bullet teams, and so there was obviously a need to do some just reinforcement of what the scope is of what healthcare can do. There was the training and education opportunity that was identified, and Robert already spoke to the joint training that's now happening and cross-training that's happening with VPD and VCH. And then there was a lot of stuff around improved data tracking as the evaluators were struggling to compare our data. They gave us lots of recommendations about lining the data up so it was a little bit easier to understand across programs. And so we've alluded to some of this in the presentation, but this is kind of what we've done with a lot of the recommendations around that community engagement and knowledge building piece. We challenged these 3 teams that have been invested in here to think about engaging the community together. So rather than what teams normally do, which is go out and have one-on-one conversations with different parts of the system, to do that engagement together and talk about who to call when and how the teams and their responses compare to one another, because as you've heard, it's a little nuanced. So they've been working on those materials, and they're going to start doing that community engagement as a group later on this month or next month. Robert's already talked about the joint CAR and VPD training and orientation, which has been really impressive to see how quickly that got picked up by the VPD and the CAR program, the VCH component, and just ran with that. I think it was a really helpful recommendation that came from the evaluation. And then we've been doing a lot of work on our dashboards and metrics. as well to be able to document the activities of what the teams have been up to. And so that concludes our presentation. As always, I want to acknowledge with this work how grateful we are at Vancouver Coastal Health. This is a unique arrangement that we have in the city of Vancouver, and we've been able to, I think, really operate teams and roll out teams in a really different way and pace, and respond to community needs in a way that we're all feeling really good about. So just want to really thank you for your leadership and support, and open to questions.
Thank you very much. That was a great presentation. Council, you have up to 5 minutes to ask questions of team members. And looking at the list, there are a lot of questions. So Councillor Kirby-Young, please go ahead.
Yeah, thanks very much, Mayor, and thank you to the whole team for the presentation and the work. My first question is sort of picking up on your final comment that this is a very unique relationship and situation. A number of us had the opportunity to be in Victoria last week for the Union of BC Municipalities Conference, where I thought was a really good and productive discussion with Minister Osborne. And I believe there were reps from Coastal, or from Health there. There seemed to be a lot of interest in sort of receiving more information on this model. So I'm just wondering if you can, and potentially the applicability of this to other cities that are experiencing similar challenges to Vancouver. I just wonder if you can comment. We had committed on our side to providing copies of your report today in reference that this update was coming to council. I wonder if you can comment on any dialogue that you're having with the health authority about the Vancouver implementation, and if you're also sharing sort of the data and the model.
With the ministry or with other health authorities?
Either or.
Yeah, I think we are happy always to chat with other health authorities about what we've done here, but we haven't had those conversations yet. We have kept the ministry updated about this work from day one. I don't know, Bonnie, if you want to add anything to the conversation that happened at UBCM.
Sure, great. Thank you so much. I was at the meeting with Minister Osborne, so very appreciative of the opportunity of the city bringing that forward and for us to be able to share that. So yes, as Caitlin said, we've been keeping the ministry apprised all along the way. We've shared all of the information following that meeting. We packaged it up. And I think we also had the opportunity to have Minister Osborne come and see the services firsthand, meet the teams, and get to know a little bit more directly about the services. So we thank you for the opportunity, and her office for making that happen.
Thank you. That's great to hear that that Mr. Osborne's had a chance to experience that, because it's our hope that this can be something picked up by the Health Authority as a great model moving forward in Vancouver and beyond. My next question is really around just daylighting some kind of clear facts. There's a lot of rhetoric sometimes that we hear and simplification around this implementation, and it usually relates to kind of just overly simplifying the numbers. 100 nurses, mental health nurses were committed to, and now it's 58. And it's not just mental health nurses, now it's 50. So can you just give us a little bit of a characterization or just affirmation that that in terms of your philosophy around that the funding envelope was given by council really to sort of look for recommendations from you and your colleagues as the health experts, and that this is the number that you feel works at this point in time, and there's been allocation to sort of other professionals beyond the typical designation mental health professionals in terms of the teams you wanted to stand up, like the Indigenous Response Team, IRT, et cetera?
Sure. So I think the first thing I would say is for the non-police crisis response teams, the work that you're doing to support those teams, we don't need only nurses to do that work. The nurses have very clear clinical guidelines in terms of that assessment, that initial clinical assessment that they've been trained to do, and we want them to be able to do as much of that as possible. But after that initial assessment, there's lots of work to be done supporting these clients to stabilize and get well. That doesn't have to be nurses. So in the current environment we're in, where there's a limited amount of nurses, and definitely a limited amount of nurses with this particular skill set, for sure our recommendation from day one would be to have this team-based care approach, which is very common in the healthcare system. So just wanting to speak to that. And then I think I spoke a little bit about the changing number. we were, you know, the overused phrase, we were building the plane while we were flying it, and it just requires adjusting. So we've always known our funding envelope, and we've just worked within that to say, okay, what exactly does this team need to be as effective as possible? And things like when you go to weekends, you're paying your staff a little bit more because they're working on weekends. So we've adjusted as we've gone. But I would really, I would also really want to emphasize that we're not even up to our full complement in mode. Like, there's still room to grow, and we are able to respond to every call that's coming in. And I think it's really, really appreciated by community, these new services that have gone in. So I think the laser focus on the FTE is a little bit besides the point. There's really, really good work that's happening and evolving and responding, which is, I think, what we need in this.
You're growing as you
Yeah.
can, as makes sense. Thank you.
Great, thank you. Well, you asked my question. That was the big one. So I'm gonna build on that question a little bit here. So, but before I start though, thank you. We've seen your team in action and how it is impacting so many lives to the good. And I've had the opportunity to ride along with Car 8788 and ACT as well. So it's really cool what you're doing. So you mentioned, you know, building the plane as, you know, as you're learning how to fly per se, and you're at 50 FTEs right now and a team approach, which is way more effective. So I just want to be very clear, because following up on Councillor Kirby Young's comment, we get this all the time where, you know, sometimes this gets weaponized, and we have to keep answering the question around 100 FTEs, and we are still committed to the funding. If we literally said, we're going to change it and give you 100 nurses, is that something you would want, and get rid of the team approach?
I'm going to say no. On behalf of I'm looking around, being like, do we agree? Yes, we agree. No, that's not how we would build a healthcare team. And there's not 100 nurses in the city who have this expertise to be able to do that. So we would say thank you so much, but could we do something slightly different?
Sure. And we'll continue to listen to you, and we'll always provide the funding, you know, the backup for that. And if your mind ever changes, absolutely. So we'll listen to you and support you. So my question here, did Minister Osborne say that the province will assume the cost of
All those questions are going to my boss, Bonnie, here.
Thank you, and my apologies, I didn't introduce myself. My name is Bonnie Wilson. I'm the Vice President for Vancouver Community Services for Vancouver Coastal Health. So in that meeting, Minister Osborne did not commit to ongoing provincial funding.
Are there other cities that are doing this right now?
I'm not sure.
Okay. Maybe
Did this go down for Bonnie? Can it? Okay. Oh, it should do automatic. Okay. It's okay. You can hear me. Sorry, go ahead.
Maybe asking in a different way, would you like to see this, these programs expanded across the Lower Mainland?
Yes. Yep. I think that the model of a non-police crisis response has been proven to be effective in Vancouver, and we're always supportive of our neighboring cities to also have the services that we have in Vancouver.
And final question here, just to reaffirm, healthcare is a provincial responsibility, right? Is that correct, or is that a municipal responsibility?
Yeah, I believe so. I believe it falls under the provincial jurisdiction.
Okay, thank you. That's all I had. Councillor Meisner.
Yeah, thank you. Thanks for being here, and thank you for the update. I'm really proud that this council advanced this funding, and to hear it's making a real difference. So really appreciate all the updates that you shared today. First question was on Car 87, Car 88, with the expansion, do you feel that the capacity right now is meeting the demand that's out there, or is there still room for further expansion in your eyes?
That's a really challenging question to answer, because the demand will always outstrip the ability to have a clinician and an officer to meet that demand. So we're, as we saw with our numbers, they're increasing. And, you know, I'm not exactly sure where we would get to where that tipping balance would be, that we have all of the resource to be able to meet the demand that's out there.
Okay. With that team of the officer and the clinician or nurse, are they, I guess, receiving other calls when they're on a call? Like, I just want to get an idea of how busy they are. I mean, clearly they're busy, but are they?
Yes, so I mentioned the back office support. So we have clinicians who are fielding those incoming calls and being able to deploy the car between calls. So if there's something that is an urgent call, it will get bumped up for a response
Okay.
over other calls. So there's no downtime in terms of the cars are being deployed.
Okay, thanks for that. And just to clarify, Car 87, Car 88, or the mode team, that is for service providers to contact, right? Not the public? Or can the public
The
contact?
public can call as well to certainly the car. There's different avenues for that. We do field calls from just the general public.
Okay, so they're, the
But,
public,
but people will call, you know, the access point that's publicized is the ACC, the Access and Assessment Center.
Yeah.
So people tend to call there.
Okay.
And then the call gets routed to the car program.
I
Or if they call the police, then it's the OCC.
okay, great. And then my next question was on the OCC. So we talked about the nurse that is assessing referrals coming in from the call board. That's fully staffed, which is great. But it's not 24/7. I'm just wondering, are there plans to extend that staffing past 11 p.m. with some of that future hiring that's still to come?
Our assessment at this point is the number of calls coming in at that non-peak hour, so overnight, doesn't warrant going to 24/7.
Okay.
That's our assessment at this point. Should that change, then we would reassess.
Okay, good to know. And then I noted that 10% of all calls to Vancouver Police were referred to the OCCLN nurse. Does that sound correct to you?
Oh, 10%?
It looked like roughly 10%.
Yeah, that's right. That's,
Stats.
yeah, roughly.
So just for people watching online and for council, you know, previous to this partnership, those calls would have received a police response. Is that correct?
That's correct, yeah.
Okay, wow. So this is obviously a healthcare approach and obviously much more appropriate for those calls.
And I'll just underscore in that the nurse fielding those calls, when they do a thorough deep dive, it takes hours. They may be on the call for a number of hours. And what we're comparing that to is when a patrol car would have been dispatched, they would have been spending hours at that one call sorting things out.
Yeah. Okay, thanks so much. Really appreciate the update.
Thank you very much. Councillor Joe?
Yeah, thanks, Mayor. Yeah, I also want to express my deep appreciation to the leadership and to the effort from our frontline nursing team. Thanks so much. Which remind me my previous career in healthcare, which I think in the interdiscipline team, and you know that's the best outcome we can achieve. And as I often said, I still think healthcare is the best industry to work with. Much better than politics, which is very divisive. Let me tell you that. Okay, question. So first question. So I saw the emergency visits was actually dropped after the intervention, 38%, pretty high. Have we done any cost-benefit analysis? How much money we saved for the healthcare system?
No, we haven't done that at this time.
Okay, so I really encourage we do that so we can do some cost-benefit analysis,
Yeah, we can take that away.
investment and return of investment. Okay, so the other question is, without this $8 million from City of Vancouver, does Vancouver Coastal Health has any resource to implement something similar as those programs?
It's really hard for me to say retroactively what we would have had. Like, I don't believe so, but it's hard to go back
Thank
into a, yeah.
Okay, thanks. And also I want to fact check some of the numbers. So we heard from some people saying that, first of all, how many nurses we hired last year in those programs in 2024? Do we know?
I'm sorry, I don't know off the top of my head.
Okay, so roughly 30, 20, or 10, or 5?
Yeah, I think it's about half of the FTE, the total FTE
Okay.
is nursing positions.
Yeah.
And so, yeah,
Thing.
yeah. So, and there's a total of 50, and we're at 41. So yeah, I guess about 20.
Okay, so we heard from some people saying that, City of Vancouver only hired 12 nurses. Where that number is coming from?
I'm not sure.
So, but that number is wrong, completely wrong, right?
Yep, it might have been one of our early reports. I'm not sure where somebody got that number from.
Okay, thank you. Other questions, in a high-risk environment, I think I asked this question before, but I want to ask that again. In a high-risk situation, how important to have police present with CAR 87, 88 program?
Very. Especially the mobile de-escalation team sits under me. So those are clinicians that are reporting up to me, are very good at risk assessment and mental health assessments, but we cannot send clinical staff into high-risk situations without VPD accompanying them. It's not fair to those staff. So incredibly important to have an option to have a co-operated team.
Thank you. Other question is, why there are still 9 FTE to be filled for this MOD program, and what is our plan to hire those FTEs?
Yep, we are posting for those positions and recruiting when we get people who have the right experience to join the teams. So we continue to do that.
Do we have a timeline for this 9 FTE to be hired?
I do not know.
Okay. Okay, let me see. Okay, so I just also want to clarify. So it was Vancouver Coastal Health's recommendation to recommend 58 FTE. It's not council's recommendation, right?
No, that framework came from work that Vancouver Coastal Health did in partnership with the city and the VPD.
Okay, thank you. That's all my question. Thanks.
Thank you so much.
Thank you, Councillor Bly.
Thanks very much, and thanks for the presentation. And I appreciate many of the questions so far, just building on some of those. First of all, in terms of the Indigenous Crisis Response Team, I wonder about any engagement with the First Nations Health Authority based on this program design, if that's something that has happened or will happen, just helping council understand the intersection there of the various health authorities.
Unfortunately, that work was led by our Indigenous health team, and the director who led it has since moved to the Interior. So she's not here today to speak to it. So I can't concretely say that we engaged the First Nations Health Authority, but she did a lot of engagement with Indigenous-led organizations, and I would be surprised if that didn't cross paths with FNHA. That's definitely part of their role in the Indigenous health team, is to work collaboratively with FNHA. So I would be surprised if it didn't, but I can't say for sure.
Okay, if there's any information that can be shared later, would
Sure.
very much like to see it. And can you outline, and I think there was a very good question from Councillor Joe regarding sort of the cost-benefit analysis to emergency room visits, but I wonder, could you do a sum total of the 3-year investment in this program so far, /2 years, and the forecasted budgeted amount for 2026, just so that we have that number? Because I see we've got 2025's costing in this report, but it's been a while and the numbers keep changing. So I just want to make sure we've got a very up-to-date accounting for how much the city has invested in this program.
In total, or forecasting to next year, or
In
both?
total?
In total,
And
okay.
then forecasted budget for the next year.
Sure, we can share that in a follow-up.
We don't have that today?
Oh, maybe we do, sorry.
Thank you for the question. I'm Jody Sider-Jones. I'm the Managing Director for Social Policy and Projects within Arts, Culture, and Community Services. So just to recap, the framework for urgent mental health and substance use was approved by Council in early 2023. At that time, 2.8 million was approved as part of the grant. Subsequently, for the year of 2024, an additional 4.6 million was approved, and then the 2025 budget was 4.15 million. Now, just to make sense of those numbers, as Caitlin has explained, the program has been ramping up, and so not all of 1 year's budget was expended, and so that overrun or carryover from 1 year is then offsetting the next year's one. So just to make simple sense of all of this year's budget for 2025 is 7.15 million. 3 million was carried over from last year. So even though you see a grant from last year that was 4.15 million, that also had a carryover. So to accomplish the 7.15 million this year, it had a $3 million carryover. We would expect that not all of this year's grant is fully expended. We may see 1 or 1.5 million potentially available at the end of this year to offset next year's grant.
Okay, so just to repeat that, in actual numbers, not budgeted or forecasted with carryovers?
Yeah, so it would have run at about 2 million for the first year, approximately 3 million for the next year, and approximately 4 for the subsequent year. And then we may see 6 for this. Sorry, I just didn't cumulatively do that, but that's what we would have seen.
Okay, that's actually quite helpful. Thank you very much.
All right, thank you.
That's about 15 million. Quick math. Okay. And then I just had a question around, and I noted some of the work that's ongoing, working with libraries was mentioned on slide 9. I think security staff, and we do hear from libraries from time to time that some of their work does sort of extend beyond library duties, right? Sometimes feels like social work, sometimes feels like police work, security. Could you just give us a little bit more detail around what the expanded access pathways in terms of that work with library staff specifically?
Yeah, so the mode leadership has met with, I think they've met with the specific branches kind of in the inner city, but as well as they brought together, the library staff brought together all of the, I don't know what their exact title is, but the kind of security folks who work at the libraries and their leadership. And they had a session with mode and let them know exactly what mode can offer and like what the right client profile is. It's not moving people along, but really like if somebody does seem to be behaving erratically.
They can call, basically.
Pardon?
That they can call.
And now we set up a yeah, so we let them know who to call for, and then then they can call.
Okay, can I move for a second round, Mayor?
Sorry,
Can I
second
move
round?
for a second round of questions?
Great. Any discussion? All in favor? All opposed? Great, second round. Councillor Maloney, you're up.
Thanks. It's my understanding that in December 2022, following the direction given by Council's 100 Nurses motion to explore, there was an aspect of it that involved exploring implementing peer-assisted care teams or PACTs via provincial funding. But the General Manager of Arts, Culture and Community Services reported that PACT may not be effective for high needs groups experiencing intersecting challenges relating to homelessness, substance use and mental health. But at 2024, VCH reported being supportive of the city advocating for PACT in Vancouver. And I know that Ecom 911 is in favour of exploring that. What's VCH's current position on the possibility of implementing peer-assisted care teams or crisis response community-led teams, which they're called now, in Vancouver?
So originally, when the city came to us and asked for guidance on that, we felt very strongly that if you're asking the health authority, we would like it to be a health authority team, because then we have access to somebody's client records. So we're able to respond to somebody in mental health crisis by looking at their history, their medication, and we can kind of put a response together that's the most appropriate response. We've had lots of meetings with the Canadian Mental Health Association, who funds the PACT teams that are kind of nonprofit, grassroots crisis response teams. And they're very collaborative meetings, and we think there might be an opportunity where you could have both without kind of causing too much confusion, right? You don't want to have so many teams that it's like, who do I call? So, but I would say it's just exploratory. We've never really progressed that into a place where there's actual funding on the table, because there's a huge demand for those PACT teams across the province. So I would say Vancouver Coastal Health is very open to those conversations, is really dedicated to learning from the PACT teams and learning from our teams and kind of cross collaboration, which we've been doing with the Canadian Mental Health Association. And yeah, that's kind of how that conversation has rolled out.
And do you think there is a possibility of more effective outcomes or efficiencies, cost savings from a successful implementation of Circle peer-assisted care team into our system?
Like, is there a possibility
of better outcomes, cost savings, efficiencies?
It's really hard for me to say. I think they're great models. I think our model is connecting people back, as we kind of tried to show in our slide deck. Our job is to connect people to the right part of the system. So I think when you have a crisis response team that's embedded in the system and can connect people to longitudinal teams, any of these teams, they're only mandated to spend 1 or maybe 2, 3 visits with a client. So they're not going to kind of help that client on their wellness journey. We really need those longitudinal teams. And so I think within the health authority, we're best placed to connect to those teams. But I don't want to disparage anything that the circle teams are doing, because they're probably working really hard to do that in other communities. So this is lots of different ways to slice a cake.
So what do you think would be the main challenges, and what have the challenges been with the mode team and in putting it into the Ecom 911 system? Like, what challenges have needed?
Oh, there's many, and the main. We've had conversations about that, and the ECOMS is a provincial. It's a provincial system, so in order to change from 3 options to 4 option to that mental health option, the conversation just has to move up to a provincial level. We're operating at a municipal level here. And then I would also say, like, the team right now is not, it's even at its maximum, it's going to be, 30 people. So we're not able to kind of respond super broadly across the city. So we've chosen to really focus on high acuity clients, not capable of, they're in supported housing for a reason, they're living in shelters for a reason, and we're really trying to support that side of the continuum that's really kind of more clinically complex.
Thank you. And just to elaborate on Councillor Meisner's question about the OCCLN only operating between...
And sorry, Councillor, you're at time, but we have a
thanks.
second round.
I'll
Thank
go
you.
on.
Councillor Dominato.
Thanks, Mayor, and thanks for the update and presentation. A couple of questions. You referenced the service providers that are calling into either Mode or CAR 8788 services. You didn't offer much in the way of geography and where that service is being offered. So could you just speak to that in terms of where the calls are coming from? Because often there's a focus on 1 or 2 neighborhoods in the city. I'm just curious if you could speak more broadly to the outreach.
Sure. So Mode and CAR 8788 are both citywide teams. So we'll take calls from everywhere in the city. I would say over 50% are probably coming from the inner city. So either, from that general kind of downtown area, downtown east side, Strathcona. But I don't have specific numbers. We could get that for you. ICRT, because it is much smaller, is a downtown east side focus team.
Okay, that's helpful. I think it would be of interest to see the sort of a geographic overlay of where the calls are coming in from and the areas being serviced.
Sure.
I'm curious around, you gave us a lot of data today in terms of assessments, making points of contact, people going in potentially into hospital. But I am curious about more the long-term trajectory and how individuals are being supported in that pathway of care. So we're, and appreciating it's going to vary from individual to individual, but I am really interested in that, particularly in the context of conversations around, there's still a need for harm reduction models. We're having conversations about secure, compassionate care for individuals who may be a harm to themselves or others. So could you speak to that and what that looks like on the ground as you're making touch points with individuals, how they're being supported in the system?
I think what I can speak to is the Mode team does a limited amount of apprehensions, right? So if somebody's a risk to themselves or others, they will apprehend using the Mental Health Act and bringing those folks into acute psychiatry facility. And what we've been really struck by over the past year is the length of, so you're taking clients who are unconnected, right, to the system. So they really are those clients who maybe are falling through the cracks for a variety of system-based reasons or client-based reasons. And we're connecting them. And when they are admitted, they're often admitted for multiple weeks, which in our world speaks to like, oh, they were probably pretty unwell. when we were able to connect them. And that's a lot of work, really understanding that client and illustrating for the clinicians in an inpatient unit why, even though they might be able to present okay for a little while, they're actually quite unwell. And so it's really bridging. So, you know, there's an entire system of connecting people to wellness, and that step of kind of bringing them into an acute setting where there is a psychiatrist, where they can get that kind of an intervention is sometimes a real hurdle. And I think we're supporting people to get there, which is then their support in the next step, right? But this funding really focused on that crisis response part, and then the rest of the system is taking. So from there, for instance, from an acute setting, you might be referred to one of those multiple 24/7 types of sites that you were talking about, it be it tertiary site or a involuntary care site. That's kind of how that trajectory might go if it was warranted based on how that client was presenting.
Okay, that's helpful. I'm curious in that vein though, is how do we reconcile, and I'm not sure you'll be able to answer this question, is if I've spent time, all the councils I think have spent time in the downtown east side, and the public is that we're still seeing a lot of people who are unwell and seem to need help. And don't see, like, how are we able to demonstrate that impact? Because I think there's a conundrum. People see us adding services, and then they're still seeing a lot of people who are really unwell, and in some cases unhoused, not always. And so I'm just curious about how we are able to track that and demonstrate that impact.
I have an answer to that, but I'm wondering if anybody else wants to hear from somebody else for a second. Here you go.
Thank you for the question. So Bonnie Wilson, VP. I think it's a really, really hard question to answer. I think that the contributing factors to the challenges that people are facing are really multifaceted. And so we, over the years, all parts of the public sector, municipal, provincial, federal, health, housing, VPD, we worked really hard together to try to come up with ideas and options to support people in a different way. So I think it's really hard to say that there's one answer, or it's hard to point to one team or one investment really having an impact when the magnitude of the problem is so complex.
Fair. That's probably my time. I'm not. Yeah, thank you.
Sorry, I'll take that off your next session. Councillor Orr.
Yeah, thank you again for the report. Lots of detailed information and lots of great questions from my colleagues. And as someone with lived experience, I'm glad that we're moving in the right direction to reducing interactions with police. So I think you said by 40% or something like that. And that peer-assisted care teams aren't off the table. My colleague, Lucy Maloney, did mention some of my questions, particularly around e-com. But I did hear from some people that they do need more support. They do need more funding. But if that is a provincial thing, I wonder, if that would be something to bring up to Minister Osborne or somebody else. Just more specifically on CAR 87, what are the wait times like in terms of if somebody from the public phones CAR 87? Are we seeing a lot of dropped calls? Because I know this is a matter of life and death sometimes. And I've heard anecdotally from people that they try and get help from CAR 87 and they can't.
Yeah, so the wait time, we prioritize those individuals where we feel that there's heightened risk, and we will divert a car to the most pressing need. So that really is how we're doing it, and all those calls are being either triaged through the OCC to go to the car, or they're being triaged by the back of house, the CAR program.
So yes, it's really a matter of prioritization. So some people. So you said there's 3,500 assessment attempts. What does that mean? Like is those like dropped calls kind of thing that you're not?
Oh no, this is where the car has been deployed.
Oh, okay.
We may be looking for 2 or 3 individuals. We may have details of where they particularly like our accustomed to be hanging out, and would the car will go by to find them.
Okay, so you're not, it's just when it's being deployed, it's not necessarily when we're interacting with somebody.
Exactly.
Okay, interesting. And then, so there was data on the assessment types, but would that be cross-referenced with like the type of referral? So what I mean is, like, would there be priority given to the referral source being the police versus a member of the public or ourselves, or is it just?
It's the nature of the call. So what the person is seeing and what they're referring to is what's going to move it up on the priority list.
Okay, and then do we have a sense of that this would be sort of reducing, basically, particularly mode, sort of reducing the pressures on police and maybe being able to redirect the police elsewhere? Is that we're getting a sense of that?
So
So I think what we would say is that we would want the BPD to respond to any questions related to any reduction for their services.
Okay, fair enough. Thank you. And then just building on what the mayor asked about, is this a provincial jurisdiction essentially? Would this $8 million, or would this money that we give, would this be considered a core service of the city?
A core service of the city?
Yeah, like this grant, would this be considered like one of our core responsibilities?
I think I would just put that back to the city. I'm not sure what your core services are.
Like through me.
To you, to the city manager.
Thank you, Councillor Sandra Singh, Deputy City Manager. Typically, formal healthcare services is not within the jurisdiction of municipalities in BC. It is provincial jurisdiction.
Okay, the reason I asked, I'm just, this seems like a really valuable program, and I'm wondering if this would be maybe sort of something that could be jeopardized in the future in budget consultations. So thanks for that. Thank you very much.
Thank you.
Thank you very much, Councillor. Councillor Fry.
Yeah, thanks, Mayor. And thank you for the presentation. As many of my colleagues have mentioned, we just came back from UBCM, Union of BC Municipalities, where there was a lot of conversation around public safety and street disorder from across British Columbia. Of course, the conversation around involuntary care came up quite a bit. And Dr. Vigo, the provincial advisor to the Premier, described an emerging cohort of substance use, mental health, and acquired brain injury. And I think Dr. Vigo might have even suggested a population of a cohort of about 30,000 individuals potentially in that cohort. How is your work anticipating this wave that Dr. Vigo's talking about, and also involuntary care as possibility as the province is kind of addressing some of those concepts?
Thank you for the question. So we are working really closely with Dr. Vigo and the province to look at a variety of options for that cohort. Vancouver Coastal Health has made some progress in that area even prior to Dr. Vigo's work, where we've identified that there are definitely individuals who have cognitive impairments, and we have looked at how we change our services and provide services for people with acquired brain injuries who may also have the comorbidities of mental health and substance use. So we are working with Dr. Vigo, we're working with the province, we're looking at different ways of offering our ACT services. We're partnering with the criminal justice, with corrections, with forensics to look at how we support the work in those areas for those individuals.
We often hear about downloading of services, but in a sense, you're uploading services to the greater health authorities across the province, and obviously Dr. Vigo's work. I appreciate that very much. I also appreciate that earlier you thanked the city for supporting what is a unique arrangement and somewhat out of our jurisdictional scope. And I think kind of riffing off Councillor Orr, these are often kind of what are referred to as core services. Yet we do have a very specific direction coming later this week around preparing the city's 2026 draft operating budget based on a 0% property tax increase while prioritizing core city services. So while it does make an allusion to protecting community grants, there's not a specific carve out for mental health and substance use or social policy grants specifically. So I'm just curious, what would this program look like if there was no money coming forward from the province or a serious reduction in budget allocation for your work from the city
Appreciate
of
that's quite a
Vancouver?
theoretical,
Totally theoretical, but we'll be
question.
debating it tomorrow, so.
And I know that that's going to be a really key point for council. And I don't envy the really challenging decisions that you have to make. Like anything, Vancouver Coastal Health works within the mandate and the budget that were provided by the province. And so should that be a situation, a really challenging situation that council would have to make, Vancouver Coastal Health would do the best that we could to see what we could do to adjust. We would obviously be quite disappointed to see some of these services jeopardized. We've been very, very grateful for the support from the city, and we would look forward to carrying on with that partnership should that be an opportunity.
Okay. But you're running a pretty lean, with the money, the grants you are receiving from the city of Vancouver, it's a pretty lean operation, it's safe to say?
Yes, I would say it is. And I think as you've seen, we've been quite judicious about how we spend the money. And so if we aren't spending the full allocation of grant, we aren't spending it. So we aren't going forward and spending the money just for the sake of spending the money. We're very careful stewards of any public purse, regardless of the funding source.
Well, I would just like to say, given that this is a receipt for information and there's no sort of comments additionally, I would very much like to thank you and everybody who works at Vancouver Coastal Health. I know many of them, and I appreciate the hard work and dedication, and it's a challenging space to work in many times. And I think on behalf of the entire city of Vancouver, we very much appreciate the work that you're doing. Thank you.
Thank you, Councillor.
Thank you very much, Councillor Bly.
Thanks very much. I just had a follow-up question, it's more, well, I'm curious about when you are sent to these calls, are there folks who would benefit from sort of more of that acute care, whether it's an overnight or a term of sort of day-to-day care, whether it's regularizing medication or just making sure that outreach can be found in terms of family, or do you see, I get the care and community and why that happens, but I'm just trying to get a sense from you in terms of if there were more options in terms of providing that complex care overnight stay, would you think that folks that you deal with day to day would benefit from that kind of care? Is there a shortage of available spaces and that affects that? I'm just trying to get the relationship between these programs and the various folks you're meeting in community. And should there be other options, would that be better suited to their long-term health and care that's needed?
Yeah, I'm going to do my best to answer some of these questions. I'm going to give Caitlin a little bit of a break. Absolutely, we do, when we are engaging with individuals, I think the team has spoken about how they do a pretty thorough assessment. And if in the moment they do see that an individual needs a much higher level of intensity of care, then they are making those connections. So either they are encouraging the individual to go voluntarily to the hospital, or if they're not in a situation where they can see that they're challenged in that way, we are able to enact the Mental Health Act and have people go to the hospital with the support of police and some of our other programs. So we do avail ourselves of that option with these services. Sometimes these are the entry point to that. And it's also the entry point to all of the other services that we have within our health system for people with mental health and substance use.
Right, but just to clarify, is there a difference between sort of voluntary or involuntary accessing more acute care? Is an emergency room or is it a mental health bed identified and specific in that type of a program?
The entry point to the hospital, typically in those urgent situations, is through the emergency room, and then they're assessed in the emergency room, and then a decision is made if they need to be admitted as an inpatient to the hospital.
And that would be in a mental health unit?
If that's the appropriate unit for them to be supported in and treated in.
Do we have a sense of how many beds we have overall in our health, in Vancouver Coastal Health in terms of mental health beds total?
Yes, that information is available. I don't have it
Okay.
off the top of my head. Yeah.
Okay. It would be, I don't know, I can't find it either, but I'm curious what that number is because we do have a lot of questions around this and we're talking about a very specific program, but there's obviously a broader issue that many of the questions have been, I think, a result of is sort of the broader nature of this crisis. So if I could request that, that would be really great. And just in my last 30 seconds to echo the appreciation and thanks to really go outside of maybe what would be typical in terms of a council direction in framing of a healthcare response, not typical. It's usually the other way around. So to work with this council over the last few years to try and add a more rigor and more capacity to programs that we know work. So thanks very much for that.
Thank you. And thank you again to Council for giving us the latitude to inform that framework.
Thank you very much. Councillor Kirby-Young.
Yeah, thanks very much. I wanted to just take the opportunity also, following on previous comments from my council colleagues, and just thanking you all for the work. It has been an iterative process, and I think that is kind of the guiding principle that we need when we're facing, quite frankly, enduring and unprecedented challenges. So I appreciate that flexibility, and I do think that it's a model that is proving to pay dividends. And I, for one, am very happy to see flex in terms of the expenditure and what that looks like. I also do want to reflect that I think that this is a good model for recognizing that there are different functions that the health component and the policing component serves. You mentioned, for example, VPD might still be deployed to a suicide or where there's physical harm, but wherever possible, there's I think the value or the goal is to direct to the health response. So I'm really grateful for that. I also am a big person of dealing in facts and level setting, as people will know, and speaking frankly. And I know that it was referenced earlier by one of my council colleagues that we're debating a motion from the mayor on property tax tomorrow. And that specifically does have language in it that carves out grants and community grants. So I'm, for one, personally, I'm very committed to continuing the funding for this work. I don't want to leave any doubt that that may not be the case. I would be surprised if my other council colleagues did not feel the same. And I think a number of us have been committed to this from the beginning, despite some of the other councillors voting against the program initially that are now thanking you for it. And sometimes it does require a leap of faith in terms of taking a risk. And so thank you for taking that leap of faith and that risk with us. We really appreciate it. And we're looking forward to continuing to support you in the work.
Thank you, Councillor.
Thank you very much. Councillor Dominato.
Thanks, Mayor. And just with our second round, maybe clerks could reset my clock. I don't have any further questions, but I am just going to offer some additional comments as well. Appreciating the work of Vancouver Coastal Health and working with the city team, as well as with the Vancouver Police Department in these efforts. And I think that's an important piece of this, is recognizing it is a collective effort. We are dealing with very entrenched systemic challenges that don't have an easy solution. But I would hearken back to Councillor Kirby-Young sort of touched on this, is that these efforts began last term. I have been resolute and vocal about the need for non-police response in response to what are clearly health issues, individuals who are very unwell and need our support. But it's also recognizing there's a continuum, and your staff spoke to that today, is that there may be some instances where interventions are needed, but you need some police support if there's a weapon. But in many cases, we know individuals are not violent. They're just very unwell, and whether it's severe mental illness, whether it's severe addictions, whether it's a drug-induced psychosis, whether it's acquired brain trauma. And I'm excited by the data you've presented and the fact that, and this was very intentional, building in an evaluation component to this work. Because it's one thing to say we're going to go and try something, but if you have no means to evaluate it, how do you know it's working? And when I was asking about long-term impacts, I appreciate that it's very hard to measure. You're going to have to follow people for many, many years to assess the value and impact. But You've identified today the complement of staff for the CAR 8788 and that's doubled. You've indicated that the mode de-escalation teams are having impact and people are seeing with interventions, post-intervention, fewer visits to ERs. Because again, that's a conversation that's happening across the province is that individuals are not ending up in the right place. It was highlighted by Councillor Fry. Yes, one of the biggest topics last week at UBCM was around communities large and small struggling with the same issues of persistent homelessness, mental health addictions, and trying to support and triage people to the right place. And what I heard today in the programming is that's exactly what you're trying to do, whether it's through ECOM and the calls into VPD with the nurses or the Indigenous Crisis Response Team, which is the first in Canada. And so I'm confident we are moving in the right direction. And like my colleagues, absolutely have all intentions to continue to support this programming. And I think there's still conversations that need to be had with the province about whose role it is to fund this. It started as a pilot. But we're seeing progress, we're seeing success, and we need to continue to work at that as well as work and advocate to the province for the other necessary supports. And some of those are the mental health beds, but some of those are the community-based mental health services, which I have talked to repeatedly to service providers. There is a gap there. And so overall, I'm really pleased to see the progress. I look forward to further. I think that is a key thing. We need to have regular updates on this work and how it's going, and also how you are reframing that back to the province in your conversations with the provincial government around how it shifts and informs provincial policy. Because you're on the ground, we're on the ground, and you're seeing it front lines, you're delivering the services, but it needs to inform provincial policy. And so for me, that's the other takeaway, I think, in all of this. So thank you for the presentation today. Thank you, Mayor.
Thank you, Councillor.
Thank you very much. Councillor Joe.
Thanks, Mayor. Also, can you set up my clock? Second round.
Yeah, sorry, I was just going to leave everything as...
Perfect. Yeah, thanks, Mayor.
Yeah, thanks.
Okay, so I have two more questions. So first of all, I heard the Ministry of Health is mandate all the health authority doing some service review. I understand the funding from the City of Vancouver is so important, but from your side, after this service review, would that affect this program somehow?
We're not getting any indication that that will affect this program.
Okay, so regardless the outcome, the program will remain as it is from your perspective.
Yes.
Perfect, thank you. Another question is, after the clients discharge from these programs, are there any community service to support them to go back to their day-to-day life and day-to-day work?
Yes, we have a variety of community-based mental health teams or primary care teams, substance use support, where people provide ongoing and what we call longitudinal care and support for individuals. So depending on what their need is, we would make sure that they would get attached to the right service to make sure that their ongoing needs are met in the community.
Okay, thanks. All right, so I'll just offer some final comments here. So I think I said enough, and also my colleagues said enough about my appreciation to Vancouver Coastal Health and also the frontline staff. As we see the great progress, there's still more work ahead. But this outcome has demonstrated our collaborative approach, bring together health professionals, first responders, police officers, and also community partners. It's making a real difference. Public safety is a shared responsibility, and I'm proud that Vancouver is taking leadership role in the province to developing this creative solution that prioritize care, dignity, accountability for everyone in our city. And also, I strongly encourage, for the next round of analysis, let's do a cost-benefit analysis to see, return of investment and, what are the benefits in terms of the community. And also, I want to say something to my colleague. I think there are some emotion and also misinformation about these programs spread out in the past 2 years. I think we are all victims for the misinformation. It's our responsibility to send the right message to the community instead of creating more division. So as a responsible politician, I think that's what we should do. I really hope that we do not hear those misinformation again, and misinformation will further divide our community. So it's our responsibility. So thanks. And with that, I really appreciate all the amazing works, and look forward to the next round of the analysis update. Thanks.
Thank you, Councillor.
Thank you, Councillor. Councillor Maloney.
Thanks. Yeah, I just ran out of time to ask. So the calls that come in overnight, what happens to them? They're left the next day and reviewed. What's the response if a call comes in overnight that would otherwise have the OCCLN, which I can't remember exactly what that stands for. Sorry.
So I'm gonna give a bit of a response, and then Robert can fill in as needed. So if a call comes in overnight and there is, it's assessed to be an urgent call, then an urgent response would be made, and it would likely be through police at that time. If an assessment is made and it's deemed that it can wait until the next morning for one of our staff to review the call and do some follow-up, then it would wait, and our staff would reach out, would do the assessment, would look up the information on our system, and then respond accordingly. But if it's deemed to be urgent, then a response would be
So
made.
there's the possibility that if it was a 24-hour day service, it might not be a police officer, it might be a different one of these other options that respond to that overnight.
Potentially, but as we've said, we've looked at the data and the number of calls that are coming in at that time. It really doesn't warrant having a nurse there 24 hours a day.
Great, thanks for that. Well, I'll just make some final comments. Thanks for clarifying also that it's definitely not the case that 100% of mental health crises require police response, and that we can have other options that can be more effective. I think there have been a couple of comments from my council colleagues about the public's misunderstanding of the 100 mental health nurse number. And I appreciate the work of Vancouver Coastal Health to clarify this and educate people about what the most effective use of the funding is, and that it's not 100 mental health nurses, even if we had them available with the right expertise. That's very helpful, but I think it's super important not to be dismissive of the public's misunderstanding of the 100 mental health nurse number, and avoid blaming the members of the public for taking the members of this council at their word, who promised 100 mental health nurses in the lead up to the 2022 election. It is the right of the public to take politicians at their word, and I don't think that we should be pointing the fingers about that misunderstanding in this chamber. Thank you.
Councillor Montague.
Thanks, Mayor. Just a couple quick questions. Can you just briefly explain the importance of the information sharing? Every organization has its own databases, and whether it's Prime or health information. Can you share how important it is for those organizations to share that information?
It's very important to be able to share the information. It's also very important to be very careful about the sharing of information. And so I think that Vancouver Coastal Health has a long history of working closely with the VPD around the information sharing agreements that really do enable us to have a very balanced approach in our responses in our partnership programs. And I think we've all benefited from that greatly over the years. I would also say that we're very careful with that information, and that we use it in a very thoughtful way, because I know that there are many individuals, many systems, many agencies that would like to have access to the information that both of our agencies have, and we see that as a privilege to have that partnership and to be able to work collaboratively, and we don't take that lightly.
Of course, yeah. Mental Health Act apprehensions. I think the last number I heard was something like, I think it was 2022 maybe, 4,500 Mental Health Act apprehensions in the city of Vancouver. That would be like Form 4, Form 21, and Section 28 apprehensions, including, I think, one person who was apprehended 79 times over a 4-year period. Can you explain some of the trends that you're seeing? Are we seeing a flattening of that, a reduction of that, and the ability, the ability the city would have without that police healthcare coordination?
Yeah, I don't have that data with me, and so I'd be very careful to speculate on that. I would say, though, with having the breadth of the responses that we have available to us in the City of Vancouver, it does give us the opportunity to be very careful when we are using the provisions of the Mental Health Act. And so I think because we have so many community options, so many supported housing options, so many teams available to us, we can actually be quite careful about when we use the Act and when it's required.
Okay. And one last question. I seem to remember in one of the past briefings from the Health Authority about the PAC teams that it was more more applicable in smaller communities with less complex issues. Is that still the case? Is that still something that you're seeing or believe?
Yeah, I mean, I think that Caitlin had responded to that. You know, I think that there are moments of time where a nonprofit peer-led response is appropriate and works quite well. And I think with the kinds of calls that our moderate de-escalation team is seeing, they are quite complex. And so having the opportunity to access healthcare information and be able to do some really seamless system navigation is really a benefit, which I think the PAC model, they're not as integrated, and so it would be more challenging. I would say, though, as Caitlin indicated, there could be an opportunity where a PAC team, or a circle team, sorry, in the City of Vancouver could be useful. So it's just, again, it's having different teams at different points of the continuum to respond in the appropriate way.
Thanks. I think that's all I have for now, Mayor.
Great, thank you very much, Councillor Meisner.
Yeah, thank you. Thanks again for all your work to get this initiative planned, staffed up and running. I know that the party that I'm a member of made the promise of 100 mental health nurses during the campaign. But obviously, you're the experts in what that should look like. And I think that's been lost a bit in the public discourse, which is what some of my colleagues were referring to. There is a political party in our city that is continually repeating misinformation around the 100-100, just to give you some context around where that's coming from. Despite, I know you've been here at council several times to clarify that, you know, you're taking the lead, you're planning what the rollout looks like, you're the experts, and it's been so frustrating as a councillor here to just see that misinformation put out there into the community over and over again. So I just want to state that for the record, and I just want to thank you for all that you've done to get this planned and rolled out, and the difference that it's really making in people's lives. I think everyone here on council realizes and believes that not all mental health related calls require a police response. That's not what we want to see. And to hear today that 10% of calls to VPD are being diverted to mode or to car 87, car 88, that gives me so much comfort that, you know, we're not sending police to a response where they're not needed, because I know that can escalate the situation in a mental health crisis, as well as using, you know, police resources that can be better used for other calls. So I just want to echo my colleagues' thanks for the huge, I think, accomplishment and difference that you're making in our city for people who are really struggling and need it. And just state as well that I'm very supportive of this funding continuing. Of course, we would like the province to help us support this funding as well, but this is just too important. I mean, mental health and addictions on our streets, this is one of the biggest challenges and crises facing our city. We hear it every day from our constituents. We experience it every day. I see it every day outside my building. It's heartbreaking. And I'm proud to know that we are working with you to help make a difference on this in our communities. So just thank you for everything for the program, and you have my full support.
Thank you,
Thank you very much. Councillor Kirby-Young.
Yeah, thanks, Mayor. Just one final comment. Councilor Meiser touched on it, but I'm just going to be super clear and super direct because I think we're all dancing around it in this chamber and being polite. And I'm just going to stick to facts because it's important we have a decorum. There was a comment made that we're blaming the public. Nobody is. It's political parties that are putting out information. And very specifically, it's one city that keeps saying we've hired with salacious graphics 12 mental health nurses. That is not correct in terms of the overall support that is happening for the program. So I'm going to continue to be an advocate that we have truth out there because I think it does a disservice to the fantastic work that you were doing. I thank you for it, and I apologize for the misinformation. Thank you.
Councillor.
Thank you very much, Councillor. Okay, seeing no one else in the queue, as per section 5.16 of the procedure bylaw, no vote is necessary as the item was intended for information only. Once again, thank you very much for the very comprehensive presentation and answering all the questions, and more importantly, all the incredible work you're doing to improve lives of our most vulnerable populations here. Thank you.
Thank you.
Okay. Okay, moving right along, unfinished business. We have one item of unfinished business on the agenda today. And that is number 1, standardized apartment districts and city-initiated zoning changes to implement the Broadway Plan and Canby Corridor Plan. At the public hearing on September the 16th, 2025, Council heard from heard the team member presentation, asked questions of the team members and applicant, heard from public speakers and closed the speakers list and received public comments for this item. Council subsequently referred closing comments, questions to our team members, debate and decision to the council meeting on October the 7th, 2025 as unfinished business. Council members who were absent for this item at the public hearing will need to confirm they review the proceedings they missed and are therefore eligible to participate in debate, discussion, and decision. Councillors Bly and Fry were absent for this item or portions of this item. Councillor Bly, have you reviewed the proceedings you missed, and will you be participating in debate, discussion, and decision? No? Okay. Councillor Fry? Okay, thank you very much. Does the applicant have any closing comments?
Thank you, Mayor Sim and Council. I thought it would be a good opportunity, since it was a little bit of time since we last spoke, to summarize and link this endeavor to some of the bigger picture changes we're trying to make here at the City of Vancouver with our planning system. What you have in front of you is a significant city-initiated rezoning in its own right. It implements in a more streamlined way existing area plans like Broadway Plan and areas within the Canby Corridor Plan. But I think more importantly, it is emblematic of a sea change in how our planning system works. Less site-by-site, customized rezoning, and more standardization and predictability. It streamlines process and helps us scale up the delivery of housing to confront the crisis in front of us. It establishes new standardized and simplified zoning districts that can be pulled off the shelf by applicants for rezoning for applicable apartment scale developments. And they will be used regularly as we implement existing area plans and create new ones, such as villages, including more city-initiated rezoning. For applicants, the fastest rezoning is one that's not needed at all. We engage deeply in area plan processes, establishing a vision for the future of communities. And standardized zoning districts and city-initiated rezonings put zoning aligned with plans on the ground, creating more certainty for everyone, including communities and applicants alike. And with that, I thank you for your consideration, and staff is here to help answer your questions.
Great, thank you very much. And it is a unique situation, so I still have to ask this question. Do our team members have any closing comments?
No.
Does council have any final questions for the team members? All right. I will remind council that we need to move the recommendation for this item together with the 2 yellow memorandums. The first yellow memorandum dated September the 2nd, 2025, entitled Standardized Apartment Districts and City-Initiated Zoning Changes to Implement Broadway Plan and Canby Corridor Plan, Amendment to Council Report. Well, that's a mouthful. And the second yellow memo dated September the 12th, entitled Standardized Apartment Districts and City-Initiated Zoning Changes to Implement Broadway Plan and Canby Corridor Plan, Amendments to Council Report and Draft Zoning and Development Bylaw. Okay, council will now make our decision on this application. Hold on a sec. Pardon? Yeah, there will be So we already went through questions and there were no takers. Now you'll have another opportunity, councilmen. There will be chance for discussion. We're good? We already asked the question and no one was in. Okay, so procedurally, how do we rewind this one back then? Do we? So it's okay? Okay, great. Councillor Fry, please go ahead.
Great, thanks. Thank you for that. Okay, so I just want to get some clarity because it came up before, and I think there was some confusion. Now, as I'm interpreting it, this sort of jumpstarts the provisions of Bill 18, which is scheduled to come into effect June 30th, 2026, which is predicated by a citywide ODP, and recognizing the comment in the report that this area accounts for 40% of all the rezoning, all the public hearings in 2025. And so just to get clarity, the reason we're bringing this forward 8 months ahead of the Bill 18 requirements is to improve project viability now for the development. Is that the gist of why we're?
Bill 18 is a requirement to introduce a new official development plan to the city. So in that way, these two projects are not related. So maybe I'm, yeah, the Bill 18 is only pertaining to the ODP. And that will come in front of council in early spring.
But in theory, this would inform the ODP.
This zoning will not inform the ODP.
Can you explain how that it does not
Sure.
inform the ODP?
So the zoning is really implementing already approved council policy. We will be integrating already approved council policy in the ODP. We are launching the draft ODP this week, so it's good timing. But this is separate. This is rezoning that's already reflecting implementation of already approved council policy.
But if we didn't do this today, it would, by the time of the ODP, negate the need for public hearings in 8 months from now.
That is correct.
Okay, that's sort of what I was trying to get at.
Okay.
This is a bit of a jump start to that.
To the public hearing aspect of, yes, correct.
Sorry, I should have been more clear. I was specifically talking about the public hearing because one of my kind of concerns, generally speaking, is where we're bypassing public hearings, where council may otherwise sort of be seen as a gatekeeper, in many cases, because we do bring forward considerations that didn't come from staff as a council through public hearings. So what I'm extrapolating then is that we're putting this all entirely on council, or sorry, on planning department now, in the absence of council reviewing public hearings on these items.
After the ODP, well, this is a public hearing for this project because we do not have the ODP.
After this, it's entirely on planning. There's no council input.
That's not, well, the input comes during the public consultation of the policy development stage. So there, like we did for the Broadway plan and the Canby Corridor plan, which preceded this implementation effort, those would still continue. That area planning will still continue even post ODP adoption. So those robust engagement activities will still be undertaken at that more site-specific level. That will continue. So we absolutely will still continue to hear from the public even after the ODP is approved. That said, we will be prohibited from engaging in public hearings for applications that exceed 50% of the floor area that are residential.
And that part I understand. I guess where I'm going with this, and I'm taking a roundabout route, is that obviously we have this major budget consideration coming up with a 0% budget, where there has been suggestions. I think last week on CBC, Councillor Kirby Young talked about what the substantial examples of cuts would be planning. I'd like to see less planning and more delivery. And I realize this is an uncomfortable thing to bring up to planning staff, but my concern is that if this requires a lot more robust work from planning staff to implement, because we're not doing public hearings and this is entirely on planning, would significant cuts to planning staff deliver the kind of time savings that are articulated in this report? So as much to say, they talk about eliminating public hearings We'll save a lot of time for applications, but at the same time, if we're peeling back and constraining the amount of planning staff that can do this work, that will still be processing these various applications on the 4,000 whatever single lots or parcels.
Well, the staff work that's gone into developing the district schedules themselves has already, we've already put in the work now. In terms of moving forward, we don't anticipate that rezoning applications are going to be coming in on every single one of these parcels. We are just establishing new zoning.
I'm sorry, we're at time. Councillor Montague.
Yeah, thanks, Mayor. I see Councillor Kirby-Young on the queue, so I'll leave it to her to clarify. One question. When I was looking at the maps provided by planning for the Broadway area, when I look at the original or the previous suggested heights and densities, and I compare it to what's being proposed now, am I right in where I saw that in some areas, especially that area between like 12th and 16th, those heights are actually reduced from the earlier suggested heights?
I'm going to defer to my colleague Chris Ma here as it pertains to Broadway plan policy.
Hopefully that made some sort of sense.
Yeah, thank you for the question, Councillor Chris Ma with the Special Projects Office. So none of the heights have been reduced as part of, they're all reflective of what the policy currently lays out. Now, there is some flexibility in heights that is embedded into the Broadway plan, and that's been reflected in the district schedules as well to kind of, it's what we're kind of calling our glass box approach to give flexibility to respond to different site contexts and considerations.
Okay, I was just looking at like some of the building heights that were proposed in the original and previous Broadway plan. And if you were south of 12th, there were some areas that would allow for like an 18-story building. And now it looks like they're more 6 to 8 story.
Oh, so I should clarify as well. All of the development options that are laid out in the Broadway plan are not being rezoned to as part of this this proposal. So in some of those locations, there would still be a site-specific rezoning opportunity to rezone to something closer to 18 stories. But the city-initiated rezoning that we're proposing is to 6 to 8 stories.
Right.
So the
Okay,
lower
that's
density.
what I was trying to get at. Yes. Okay.
Yes,
so
that's correct.
Okay. Thank you. I appreciate that.
Thank you very much. Councillor Kirby-Young.
Yeah, thanks. Just a quick follow-up question is, generally speaking, I always ask the pragmatic question, sort of the so what. So, and part of the goal, I think, is speeding up housing, but what do we estimate? Like if I'm doing one of these projects, what time would somebody save by not having to do rezoning because the public consultations happen on the front end and not as well on the latter end?
Joseph, did you want to take that one? This is Joseph Tohill will answer that.
Thanks for your question, Councillor. Joseph Tohill, Planner and Community Planning. So staff anticipate that under the city-initiated rezoning where applicants can proceed straight to a DP application, it would reduce the overall processing times by not having to go through a rezoning process. Rezoning process can typically take 12, 14 months, even longer than that. So that is being removed. But we also do need to acknowledge that it is a shift in our approach for development approvals. So there may be some increases in the processing of DP applications in recognition of that. But overall, staff will be seeking to continue to streamline and learn from this shift to further improve application processing times.
Okay, but so maybe not a full savings, but fair to say, I just want to be clear that it could save a year on delivering a housing project?
Certainly removing the rezoning, which is a year, would save that.
Yep. Okay, and the cost of the rezoning?
And the cost of the rezoning application as well, too. Those fees would not apply because there would be no rezoning application.
Which might typically be on an average?
It depends on the size of the site. It could be from 6, actually, maybe Templar.
Thanks for your question. Typical rezoning applications, say in Broadway plan, range anywhere from the 80 or 90,000 on a smaller site up to 150 or more. Just again, mostly driven by site size is the denominator.
Okay. And then, thanks. And then the other thing I thought I would help to clarify, and thanks to Councillor Fry for the comments about the interview, and he referenced when I was talking about planning, just to be clear, I was not talking about planning staff, I was talking about planning of capital projects, which was congruent with the message or the motion I brought forward previously around getting more projects actually delivered and community amenities as opposed to referring specifically to planning staff. So that might be a helpful clarification for everybody. And typically in the planning department, we recover a lot of our fees to support the staff work, do we not? Maybe our.
I'm going to pass that to Josh.
Would like to speak to that?
Yeah, development approvals, including rezoning, is a fee for service
Model.
scenario. So it's designed on a cost recovery model throughout the system from rezoning all the way through
Exactly.
building
So if
permits.
we don't have staff, we can't take in the fees and we can't process the application, but we recover it back.
Correct.
Excellent clarification. Thank you.
Thank you, Councillor Maloney.
Yeah, I just wanted to give staff a chance to finish answering Councillor Fry's question that he ran out of time for.
Yeah, hopefully, councillors, I can help clarify the relationship between things like the ODP as well as rezoning. In this instance, where we're city initiating a rezoning, an applicant can take that rezoning if it fits their ambitions and go straight to development permit. And there's a little bit of let's say reweighting in terms of what we require in staffing. We won't require the rezoning resource, especially in the short term. We might require a more resource to process development permit applications that might have a bit more complexity than we're used to. And again, the effort will be to streamline those things. In the instance where you're doing a rezoning and you're taking that through to council and we have an ODP in place, it's not that there's any real difference in processing time or staff requirements or budget requirements. Those applications, if they're aligned with the ODP, still require a council decision. It's through a regular council decision and vote, absent of a public hearing. There still is a council decision in those cases. So there is, in our view, no material difference in terms of processing or staff requirements or budget requirements associated with that change. I hope that helps clarify.
Very much.
Thank you very much. Okay, so council will now make a decision on this application. Do we have a mover for the recommendations and the yellow memos? Sorry, who moved? Okay. Councillor Kirby-Young, seconded by Councillor Dominato. Council, is there any discussion? Okay, all right, Councillor Orr.
Yeah, just want to say, just when this report came to council as a referral report, I voted no on this because I didn't really have time to read the 400 pages, but like I couldn't consult with other experts as well because of the time. Once it was referred, I couldn't no longer speak. But ironically, I heard a lot of excellent debate in the public hearing about the merits of public hearing, and I have found them valuable in my short time here, like things like that discussion around hydrogeological questions around that zoning on 16th, or hearing applicants commit to TRPP for ineligible residents, things like that. So in the actual hearing about this proposal, I heard from pro-housing advocates who said this will reduce costs, and I appreciate that. And I heard from renters who said it will have the opposite effect. So I'm very torn on this. Yeah, and I just wish I had a little more information to make the right decision on this one. Thanks.
Thank you. Councillor Fry.
Yeah, and I'd hoped for another round of questions, but I'm going to try and weave some of them in here. I mean, to my earlier point, a lot of this is based on the assumptions in this report that are based on a largely intact staffing department for planning, design, and urban sustainability. And I do worry in that larger context of what a zero budget might look like if there are cuts to that department, if it changes the outlook on this particular report. But I want to ask a question through you of the Director of Planning. We heard from a speaker, Ian Doddington, who does smaller scale infill development. And paraphrasing, he's concerned that the RM4, which allows 1.45 FSR outright, and he was, and it's otherwise going to go to an R1 at 1 FSR rather than 1.45. Is this a downzoning of infill sites as he had articulated in his comments? Does anybody recall that from the?
Hello, Councillor Fry. I also, Marie Linehan, Development Planner. I also remember that speaker, and he was concerned that the RM3 zoning was a down zoning from his current zoning, but the maximum density in the current zoning is 1.45, and that's the lowest density in the new R3 schedule. So the density in the new R3 schedule ranges from 1.45 to 3 FSR. For apartments, depending on the lot size. So it would not be a down zoning because the density that's available is more than currently. He also had questions as to whether townhouse development would be an option or whether you sort of have to do an apartment. And you certainly don't have to do an apartment. There are options to do townhouses or to do multiplexes, so kind of a range of low-rise options.
Okay, thank you. I appreciate that because I reviewed the tape and I wasn't here for that, but I'd heard it and it had some questions for me. Okay, appreciate that. Lastly, and I just, if I could, to the Director of Planning, just to catch up on some of the, what you're suggesting, that this still gets the council lens. And one of my concerns around the public hearing, and because we've actually dealt with this, is around TRPP and the tenant relocation protection policies where the developer may not be adhering to the intent of that. And I previously suggested an amendment, which you accepted, for having an option for your department to address any concerns with the tenants and ensure that the TRPP was performed to their satisfaction. So my concern is, in the absence of a public hearing, issues like that may fall through the cracks. But can I just get some clarity and confidence that in fact these will be coming still to council for some kind of decision, not a public hearing, but members of the public could reach out to us and say, hey, the TRPP is not being abided by in the proper way. Can you flag this and that kind of thing?
Yes, that's correct, Councillor. We receive input about the efficacy or how the TRPP is running through a number of channels, not just through public hearings. And our intent is to make updates systematically through updates to the TRPP, one of which is happening next year. So insofar as there's feedback that happens through any channel, we want to receive that and consider that as we evolve that policy to make sure it's functioning the way it was designed.
Perfect. So to be totally clear, we will be able to receive feedback from the public unfettered, just not in a public hearing format, and we can take that feedback and inform our future decision-making or any direction to you, that kind of thing.
Yes.
Absolutely great. Thank you. Thanks, Mayor.
Thank you very much. Okay, so I'm now going to call a vote. If we can please go to the voting panel, and council, if you can register your vote. Okay, and that passes with Councillor Orr abstaining, Councillor Bly absent, and Councillor Klassen absent. Thank you very much. Okay, that completes unfinished business item number 1. And what I would suggest, I don't think we can get through the next item in 2.5 minutes, so I suggest we recess for lunch. Pardon? Yes, the proclamation. Okay, welcome back, everyone. Do we have to wait till 3:30? Nope, we can just keep going, right? Okay. Okay, item number 2 is the next item on the docket. Kitsilano Secondary Synthetic Turf Replacement and Sport Field Lighting, license agreements, custody, care, management of land, and expenditure of development cost levies. Before we begin, does anybody wish to declare a conflict of interest? Request to speak. Councillor Dominato, are you declaring a conflict? Okay. Nope, that's fine. Thank you. Okay, this item does not have a team member presentation, so Councillor Dominato, you did hold this item, so you do have 5 minutes to ask questions of team members.
Thanks, Mayor. I just wanted to follow up a question I had submitted earlier about the lifespan of the turf. And my understanding is typically it's 10 years, depending on condition. In this case, Park Board's being asked to replace it earlier than that as part of an agreement of the VSB. And I think I noted in the report that this may displace other priority projects. And could you just expand on that and why this is being initiated now versus maybe in 2 or 3 or 4 years' time? And what it is displacing? I'm just trying to kind of understand more fulsome the context around this decision.
Yeah, good afternoon. Thank you, Councillor Dominato, for the question. My name is Tina Mack. I'm the Director of Planning and Park Development at the Park Board. So we reported to the Park Board in July of this year for their request to explore this partnership opportunity. And as we had discussions with the school board requested that as part of this agreement, we would replace this field somewhat earlier than it is due for replacement. It's due for replacement in about 3 to 5 years, in part because notionally, we'd be adding about 3,000 playable booking hours per year. We'd wear that field down sooner. So the cost to replace the field surface, about $1.3 million is what we said in the report. We're still finalizing those costs. When we reported to the Park Board in July, we found some opportunities in some park renewal projects. We identified John Henry Park and Jonathan Rogers Parks as potential funding sources, which would mean those projects would have to be deferred. But subsequently, as some of our other capital projects have been progressing, we're finding we have some surplus funds in some other accounts. And so we'd be reporting back to you all through a quarterly adjustment in the spring of next year when the costs are finalized with the confirmed sources. So it looks like there'll be very little impact on the park portfolio projects, but that's yet to be confirmed.
Okay, so, and when we reference Jonathan Rogers and did you say
John Henry Park.
Or in that case, would it be, are they a higher priority to replace?
So thank you for the question. So we put that forward to the board, and the board made the recommendation to proceed based on this opportunity.
Okay, and did they consider the uses, like how heavily used Kitsilano is versus these other 2 fields? Like, was that considered in terms of advancing this, even though it's not in need to be replaced this time?
Yeah, thank you. The board considered the options at John Henry Park and Jonathan Rogers Park. They're actually not sports field projects, so advancing this one doesn't defer other sport field projects in our current capital program. It defers some park renewal projects, some field use, some dog off leash area proposals for those other parks. But as I mentioned, subsequent to the board decision to potentially defer those named projects, we found there are some surpluses emerging and some projects advancing ahead of schedule and under budget, and we should be able to have very little impact on other planned projects to be able to advance this one.
Okay, I'm more speaking aloud. I'm just trying to rationalize why we replace a field before it needs to be replaced when we have other needs. We've endorsed for the next capital plan another turf field. There's others in the queue. I'm just trying to understand the analysis that was done at Park Board for this, and would it have not made more sense to have this included in the next capital plan, given it doesn't need to be replaced at this time, and use those if you're talking about surplus funds to other imminent high needs, and I don't have a line of sight into what those are right now, but I can only imagine I've seen the Park Board commissioners and chair talking about how they have other needs. So I'm just trying to understand again why this? now if it doesn't need to be replaced?
I appreciate your inquiry. And so when we reported to the board, we did give them the option of either A, deferring to the next capital plan, perhaps at a time when the field surface was due for replacement, or advancing it now to give our users, our field users in particular, I guess that assurity. But I can't speculate why the board made the decision. We, as staff, acted their direction.
Okay, so my last question, Mayor, would be would we, if we don't support this, refer it back to staff? If makes sense to be, I guess I'm looking for some procedural guidance. I'm not sure if that's the decision. I'm just speaking out loud right now. Procedurally, I guess to you, the city manager, what are our options as council? This is coming to us. Park Board's obviously made a decision, but can I get some guidance?
Sandra Singh, Deputy City Manager. Councillor, I think if council is not ready or doesn't feel like you have sufficient information to make a decision on this matter, you can certainly refer it back to staff and we can cancel at a future date.
And we're at time.
Okay, thank you, Mayor.
Great. Councillor Kirby-Young.
Yeah, thanks. I have two quick questions since we pulled this report. And hi, Tina, like the old days. The two quick questions are, am I correct in understanding that we don't currently have a turf field agreement here, so this actually adds to our capacity and we have a dire shortage of playtime and access in the city? So this would actually give us one new field?
Correct.
Okay. And which is pretty amazing because I know that we're hearing from sports federation groups and teams all the time that are just desperate and they want to play in their own city and they want to get space, hopefully at a decent time that for kids and everybody else, right? My second question is around one of the conditions is coming to a mutually agreeable use agreement. I know it makes reference in the body around the intention is that the school gets school time and then the park board gets the other time. So if we're approving this as a suite of recommendations, my question is, we are confident that we will have full and unfettered access for after school onwards in the evenings and the weekends? There won't be any shutting or shut off of or access to the field?
Thank you very much for the question, Commissioner, pardon me, former Commissioner, Councillor Kirby-Young. So we have some great examples of existing joint use agreements, Hamber and Van Tech, which we're in the process of renewing. So the partnership works great with the school board. The school uses it in the daytime, we have evenings and weekends, and through our joint use agreement, we outline the specifics. So in those after-school, weekend, summer hours, they need to approach us for bookings. Should we want to use it in the school days, we approach them for hours. So it's a great partnership that serves our community around the clock, around the year.
So reflecting back, council can have full confidence it'll be unfettered access on that basis?
During our times, yes.
Okay, thanks. I'm happy to move the recommendations, Mayor.
Great. Thank you. Seeing no one else in the queue, is there a seconder? Great. Councillor Joe, thank you. Council, is there any discussion? Seeing no one in the queue. Okay. Do we have any, is Councillor Clausen online or no? No. Okay, great. Thank you. I'm now going to call the vote. If we can please go to the voting panel. Great, and that passes unanimously. Thank you very much. That completes report number 2. Report number 3. Thank you very much. Report number 3, overholding agreement and grant of Creekview Co-op at 1483 Lamies Mill Road. Recommendations. Now, before we begin, does anyone wish to declare a conflict of interest? Seeing no one in the queue, no one's hands up. This does not have a team member presentation. Councillor Kirby-Young, you held this item, so you have up to 5 minutes to ask questions of team members.
Yeah, thanks. I wanted to pull this to take the opportunity to ask a question of our team around how this report fits into the overall work that's happening in the council direction to move forward with delivering more co-op homes, and that being a priority that was identified as part of our housing mix for this term, and also in terms of the commitment to both renew the existing co-ops, but also make space to bring new homes forward on trying to sort of robustly utilize those lands and that opportunity. I note that there's a reference to a report coming, I think it's Q1 next year. I wonder if you can just provide some comment around what are we going to expect in that report? What's the nature of what it's going to cover?
Yes, Ryan Bigelow, Managing Director of Non-Market Housing Development at the City of Vancouver. As you say, Councillor, yeah, there is a report back anticipated in early 2026, which will include an enhanced development plan for False Creek South. So this particular co-op is in that area, and so it's part of a larger redevelopment plan or concept. And so we'd like to overhold with this co-op for this period of time until that plan is clear, and so we can understand what and work on what a future partnership would be with Creekview in the case of redevelopment. So that planning work is still underway, and there's ample opportunity for expansion and replacement of existing co-ops. That's being seriously considered through that planning process, and more details will come in the new year.
Okay, so that'll be a proposed, like an actual plan outline in terms of how we can deliver more homes? Like that's what we'll see in that report?
Not as closely related to all the intricacies of that planning process, but it'll outline an updated, enhanced plan that was part of your council's earlier direction. So, yeah.
Okay.
And yeah, in terms of different uses, and types of affordability or types of housing, from co-op housing to leasehold strata, market rental, that sort of thing for the entire area.
Okay, thank you. Happy to move the recommendations, Mayor.
Great, thank you. Is there a seconder? Councillor Orr, thank you very much. Council, is there any discussion? Councillor Kirby-Young, is that still you or is it, that's done? Oh, perfect. Thank you very much. My bad, I should have advanced you. Okay, I'm now gonna call a vote. If you can please go to the voting panel and register your vote. Great, and that passes unanimously, and that completes report number 3. Thank you. Number 4 is done. Okay, the next item on the agenda is referral report number 3, CD-1 rezoning 441 East Pender Street. Before we begin this agenda item, does anybody wish to declare a conflict of interest? Seeing no one, this does not have a team member presentation, and I think Councillor Kirby-Young, you held this, right? Okay, please go ahead. You have up to 5 minutes to ask questions.
Yeah, I'm going to paraphrase because I don't have my screens back up after coming back. But at the last council session in September, I moved and council supported to refer this to staff for information back with respects to if we'd follow best practices in terms of engagement and our procedures and any substantive changes made around the application. I know we received a memo back from staff. I'm wondering if you can comment, there's specifically, and I know we're still getting feedback around the ability for Chinese seniors to participate. I know in that memo it referenced that Shape Your City is available in multiple languages, but I think there was a reference that the actual application documents were not available in that language. We're still receiving entreaties that the Chinese seniors immediately nearby were not allowed to participate. So that's my first question, and I have a few, so trying to be expeditious.
Thank you for the question. So the memo you were referencing was a confidential memo sent to council with some extra details, but we can share that we did share publicly last time as well, that our Shape Your City page does include translation provisions to it. Our standard protocol now for submission of applications is not to require multiple languages. It is just in the English language. So from a process perspective, we did follow our standard process, which is to just submit and provide publicly information that was submitted by the applicant.
Sorry, can I jump in? And I apologize if the memo is confidential. I don't have it right in front of me. But if this is a public process that's supposed to be conducted in public transparency and council asks questions to ensure in public that was done, why is the memo confidential? And it's around engagement.
I can turn to our legal counsel for some support on that.
Okay. I want to be quick because I want to save some time.
Good afternoon, Mayor and Council. Jeff Greenberg. The reason why the memo was confidential is it contained legal advice and subject to solicitor-client privilege. And unless Council waived that solicitor-client privilege, we wouldn't put it in a public hearing document. Yeah.
Okay. Maybe I'll just thank you, Jeff. I appreciate that. Mayor, maybe I'll just take this opportunity to say that I have concern and issues with this application. And I'll try to restrict my comments to what's been discussed in public and information available, is that there was a proposed housing mix that was put forward that was changed substantially after the public engagement. There was, although while I recognize council doesn't make decisions on nonprofit operators, there was an operator identified. That was also changed, I believe, subsequent to, which has also been daylighted publicly, to the close of public engagement. There were groups that asked to participate. and had language barriers and were not able to. Council's still receiving emails. I believe we had a follow-up one today. And I don't think that this has met the standard, not only was the housing tenure changed, on-site support services have been removed. And to me, it's a substantively different application than the one that the public was engaged on from my perspective. And I don't think that we follow best practices in allowing people to participate who have reached out multiple ways wanting to do that. So I have difficulty in supporting this referral report because I do not think it has met our standards.
Thank you very much. Councillor Meisner.
Yeah, thanks. I also have received a few emails about this from Chinese-speaking community members. I'm just wanting to ask some questions for you, Chair, if I may, on the process. First question was just to confirm if this is referred to public hearing, the postcard, if there will be a postcard mailed out, and if so, what language will that postcard be in?
Thanks for the question. So yes, postcards will be mailed out as well as our standard notification in the newspaper, which is our charter requirement. So we will be following our standard procedure. And I can certainly take back the comment about the language options. Usually there is options of how to find out more information, which will take you back to our Shape Your City page in other languages, to which then the Shape Your City page has other language options on it.
Okay, but just to confirm, the printed material is only in English.
It does have descriptions in other languages as to where you can find out more information, which will then allow you to find that information in other languages. Appreciate the comment before that not all the application material documents are in other languages, but our Shape Your City page does allow for the transition.
Okay.
I will also just clarify for the record, what was submitted by the applicant was for 100% shelter rates, but through clarification conversations in March this year, it was clarified that what they had intended to apply for was social housing. We engaged the public on a social housing project, and so that has not changed since the application was engaged upon. So the public was engaged on a social housing project, not a shelter one, and that has not changed from what's in the referral report as well. It's still for 100% social housing.
So the referral report is not, the project that is to be referred is not 100% shelter rate.
Correct. It's for 100% social housing.
Okay, thank you. Just sorry, one more question for you. On the notification protocol, you mentioned something about, I wasn't quite clear, like, do we used to provide notification in Cantonese or Mandarin in that specific area of Chinatown, Strathcona?
Not in this specific area. We certainly do in certain areas as well. So if you think of something on Main Street or on Pender, we have in the past issued notification in Cantonese and Mandarin as well. Think of other locations like Punjabi Market, where we've issued it in other languages too. So we can certainly take a broader look, and I think we've already, just from this conversation, taken that back as staff to relook at how we do this more broadly. What I can say is we have followed our standard typical procedures, and when we did learn from the public that that was an issue for some of them, we've taken steps to prepare for the public hearing to ensure that there are other language translation options as well for the public hearing.
Mm-hmm. But in order to issue, say, postcards similar to what you did on, say, Main Street in Cantonese or Mandarin, do you require council direction for that, or are you going to take that feedback?
We can certainly take that feedback. I don't need direction for that.
Okay. Okay, great.
Thanks.
Thank you.
Thank you very much. Councillor Joe.
Yeah, thanks, Mayor. Yeah, I also heard a lot of concern from the seniors in that neighborhood, especially from the Gay Community Care Society. I think Councillor Kirby and Councillor Meisner asked all my questions, so I have just one follow-up question regarding the procedure. I think we never decline any referral report. So what happens if this referral report is not passed? What happens next?
So if it's not referred, there's actually only been one case where I've been here at the city where a project wasn't referred. And in that case, if you're not going to refer it, the best thing would be to provide staff with direction on what you'd like to see in order to refer it back. What we'd hate to see is it just kind of sit in limbo without clear instructions. So if council isn't satisfied with the process that's undertaken to date, referring it back with some specific direction would be the approach to do that. But as mentioned, we think that the topics that are being discussed are ones ready for a public hearing and for a broader receipt of public information and debate and decision.
Okay, so if this one is not passed, how long is it going to take to bring another referral report back to council?
In this last round, we came to the next meeting having provided council with the legal advice and the information that they had requested. So depending on what council's purview is today, if you wanted to see something else or something different, the timeline to get back to referral would be subject to what that direction might be.
Okay, is the applicant going to do another public engagement for this project?
We're not proposing to unless we're directed to.
I see. Okay, thank you.
Great.
That's
Thank
all
you very
thanks,
much. Councillor Montague.
Yeah, thanks, Templar. You could probably still stand there. Um, you said that that the original application was social housing. But again, social housing is, the definition is no one seems to ever understand it. I mean, it's everything from shelter rate all the way to BMR, correct?
So the application materials that were submitted indicated 100% shelter rate, but through discussions with them, what they had intended to apply for was 100% social housing as defined by the Downtown East Side policy.
How is that defined? Yeah.
Sarah Cranston, rezoning planner for this application. Social housing as defined in the Downtown East Side is 30% at Hills, and then a minimum of 1/3 at shelter rate or income assistance as well. And then the rest could be up to market rates, the remaining third.
Okay, so a third.
Yeah.
And that's what, so the
And
referral,
that's the minimum affordability that we secure. Should the operator wish to maximize that affordability, we would not object to them doing that. We secured the minimum rate of affordability.
okay, so the referral that's going through, is it a third?
Currently, as proposed, we would regulate for the definition of social housing in the Downtown East Side, which is a third.
Okay. Okay. Clear as mud.
There are other requirements that accompany that housing agreement as well, which would be that the units are owned and operated by a nonprofit. So those are the two big items of the housing agreement.
Okay.
The affordability and then the nonprofit ownership and operation.
Okay. I think that's clear for me. Thank you.
Thank you very much. Councillor Fry.
Yeah, thanks, Mayor. I was reluctant to opine on this because I live very close by, but I have tracked this particular project and neighborhood issues. First and foremost, I mean, this block is literally a block with Chinese language signs on the street signs. It's Chinese and English. So the fact that we didn't do appropriate Chinese language outreach is a miss. I'm looking at the application booklet on the Shape Your City site, which still names the previous social housing provider, not the new proposed one. And I will note that the new housing partner was operating a facility directly across the alley, which has had some problems with trash management and various different issues in play, and I think would have been germane to public input to inform this. So I do think that we've kind of missed some of the pieces that are necessary to make this a fulsome public outreach and checking those dots. Appreciate that it would ultimately come to public hearing, which would afford those opportunities, but I think the preliminary part hasn't landed completely accurately, and I think that's problematic. So I do support the conversation to reject this referral and have them send it back and do the public outreach properly.
Thank you very much. Councillor Meisner.
Yeah, thanks. I just hoping to ask one more question through you, if I may. You were talking about, sorry, I don't know your other colleague's name.
Sarah.
Sarah was mentioning about the city secures the 1/3 model, but that's the minimum. Is there anything preventing the operator from operating the whole building as, say, shelter rate housing under that social housing definition?
So those are minimums, and as Sarah mentioned, if the operator over time chose to deepen the level of affordability, they certainly are permitted to within the definition of that construct under the social housing definition, as well as our housing agreement. But again, those are all items that can be debated at the public hearing too.
Okay, but are we aware of any intention on their part to move in that direction?
I'm not personally aware of anything.
Okay, thank you. That's it.
Thank you very much. Councillor Kirby-Young.
Yeah, thanks. I think I mentioned that I'm having difficulty supporting it for those reasons, but I haven't necessarily heard. I feel a bit of a rock and a hard place where staff are suggesting that we'll quote sit in limbo without direction. But I think the concerns have been clearly identified. So unless staff wants to supply some language that would speak to how they might conduct fulsome engagement or something of that nature, or based on the actual specifics of the application, I'm just going to simply oppose. Thanks.
Thank you very much, Councillor Maloney.
Yeah, I'd appreciate staff suggesting some language that might be appropriate. Maybe we could recess for 10 minutes or something to help staff come up with something appropriate to help us make sure that the right direction is given and that this doesn't just go off into the ether and not happen. I don't know quite how to do that though.
And I think we need a seconder for that. All right. Okay. Why don't we recess for 10 minutes and give our team the opportunity?
Thank you.
Thank you. So we'll come back at 4:03. Councillor Maloney, you have the floor. Okay.
I understand that staff is emailing to us all some wording that we can consider.
Okay. Here we go. Yeah. Get that up on.
And I'm happy to move the draft motion if so. Has everyone got the draft motion?
Yeah, we're just gonna get it put up on the.
Great.
Yep. In the meantime, Councillor Kirby-Young, go ahead.
Yeah, I have a question through you, Mayor, if I might, and I'm just, with respect to the content of this only addresses one element, which is about and suggests an open house in Mandarin and Cantonese. It doesn't address the fact that the original public engagement was conducted in an application that is now substantively different here. And so I think that the feedback when I made the original referral motion was intending to address multiple issues. This only addresses one. So did staff give consideration to conducting another engagement process or to actually doing an engagement process which deals with the specifics of the application that we actually know that we have now? Because this to me deals with only a small facet of the feedback that, or the request that council has for more information back on.
Thank you for the question. And without implying too much on what might be inconsistent, we did clarify before that the depth of affordability was clear at the public engagement, that it was for 100% social housing, not for 100% shelter housing. I would suggest that as part of this public engagement, referral back in person, all of that would be made abundantly clear as to what we were engaging on and what project was being engaged upon, which would then ultimately come back to this council as well.
I'm sorry, can I ask for clarification? Because you said it would be made abundantly clear, but to whom? Because there's other stakeholders in the neighborhood that also provided feedback, like Strathcona residents, and
Sorry,
this only speaks to conducting a session in Mandarin and Cantonese.
Councillor,
So
sorry, you're at time. Now, one thing, sorry, can I pause here for a sec? Because we're looking at an amendment, I think we should be going to an amendment queue. There's no motion on the floor yet. Okay, so then Councillor, you're at time. Sorry. Councillor Maloney.
I'm happy to give Councillor staff time to answer the rest of Councillor Kirby-Young's question.
Thank you as well. As mentioned, in March 2025, they clarified their application materials, which was for 100% social housing. When we got to the public engagement, the Q&A, the open house, it was for 100% social housing. That has not changed. So as part of this engagement and this new open house, we can make that clear as well, that that is the proposal that is being put forward, is for 100% social housing. So that can be made, again, abundantly clear to the public, and that would be the project that is then referred to public hearing. So I hope that clarifies. I think the other change you might be referring to might be the operator. That did change but after the engagement, and as mentioned before, as part of our earlier references, the operator is not actually finally determined by council at this stage. That's not actually the purpose of the public hearing. It's certainly something that can be debated and discussed at the public hearing, but it's not typically something we secure at the public hearing through our conditions.
Thank you.
Thank you.
Thank you very much. Okay, seeing no one else in the queue, would someone like to move a motion? Yeah, we're moving the not yet, no. Okay, Councillor Bly, seconded by. Okay, so that was the amendment. No, sorry, referral motion. Okay, seconded by Councillor Joe. Sorry, Councillor. Thank you. I'm going to read that one there. All right, there we go. Moved by Councillor Maloney, seconded by Councillor Kirby-Young. Council, is there any discussion? Seeing no one in the queue, I'm going to call a vote. Clerk, can we please go to the voting panel? And that passes unanimously. So that completes referral report number 3. Okay. Bylaws. We have 7 bylaws on the agenda. Thank you, by the way. 7 bylaws on the agenda for enactment. Before we begin, does anybody wish to declare a conflict of interest? No. Okay. Council members who were absent for the meetings related to public hearing enactment bylaws must confirm that they have reviewed the proceedings of the meetings, including the video clip, to be eligible to vote. Bylaws 1, 2, and 3 were from the public hearing on September the 18th, 2025. Councillor Bly and myself were absent for this item at the public hearing. Councillor Bly, have you reviewed the proceedings and will you be voting on the enactment? Great. And I have not and I will not. Would someone like to move the motion to adopt bylaws 1 through 7? Councillor Dominato, thank you. Seconded by Councillor Kirby-Young. Council, is there any discussion? Okay, all those in favor say yay. All those opposed say nay. Great, the motion carries unanimously. The list of approved bylaws can be found on the city's website. Notice of council members' motions. Are there any notices of council member motions for the upcoming standing committee meetings? Reminder to please state the title of the motion and the date of the standing committee meeting on which you intend to move the motion, and be sure to send the title and the date of the standing committee meeting via email to the city clerk. Councillor Bly.
Thanks very much. I have 2 notices of motion for the November 5th meeting. The first is ensuring continuity of the women's equity strategy following the closure of the equity office. And the second is advancing a gender-based violence prevention strategy.
Thank you very much. Councillor Orr.
Yes, for the October 29th Standing Committee, no more developer handouts requiring the full replacement of waived SRA conversion fees.
Thank you very much. Councillor Maloney.
Safe streets for trick or treats, creating safe pedestrian areas to make Halloween a little less scary for October 29th Standing Committee meeting.
Thank you very much. Councillor Dominato.
Thanks, Mayor. I have 2 notices of motion. The first one, support for BC Parks Foundation's Learning by Nature initiative, submitted by myself and Councillor Zhou for the October 29th Standing Committee meeting. And the second motion is coordinated accountability for the downtown east side, submitted by myself for the November 5th Standing Committee meeting.
Thank you very much. Councillor Fry.
Yeah, I have 2 notices on motion for the October 9th Standing Committee and...
Or October 9th or 29th?
29th, sorry.
Thank you.
Thanks for that correction, Mayor. And that would be, titled number 1, implementing a reduction in FOI fees, and number 2, youth voices, amend the charter for age 16 starter.
Thank you very much. Okay, seeing no one on the queue, last chance. Right, we're going to move on. Thank you very much. New business. We have 1 item of new business on the agenda today, and that is requests for leaves of absence. This motion has been circulated to council at the beginning of the meeting and is available on the screen. Let me just, everyone take a moment. Make sure it captures everything. Everyone get a chance to review it for accuracy? I'll assume that's a yes. So would someone like to move a motion? Councillor Dominato, seconded, I think, by Councillor Meisner. Council, is there any discussion? No? Okay. All those in favor say yay. Yay. All those opposed say nay. Great, the motion carries unanimously. Council, are there any other items of new business? Councillor Dominato.
Thank you, Mayor. I do have an additional item of new business, and it is a motion that Councillor Zhou assume acting mayor responsibilities for myself, Councillor Dominato, November 14th through to November 22nd, 2025.
Thank you. Is there a seconder? Councillor Zhou, thanks. Any discussion? Okay, all those in favor say aye. Aye.
Aye.
All those opposed say nay. Great, that passes unanimously. Councillor Zhou.
Yeah, thanks, Mayor. So I also have a new business which I sent to the council members in the morning. So it's a change to business license hearing panel. That Councillor Montague replaced Councillor Zhou as a panel member at the business license hearing to be held on October 14th. And then Councillor Zhou replaced Councillor Montague as the alternate at the business license hearing to be held on October the 14th. Thanks.
Second.
Very good. That was Councillor Montague. Great, thank you. Any discussion? All those in favor say aye.
Aye.
All those opposed say nay. Great, the motion carries unanimously. Last chance, any other items of new business before we move on? No? Okay. Inquiries and other matters. Council, are there any inquiries or other matters? Councillor Orr.
Yeah, this is going to be hard. There's been a lot of talk today about misinformation, and I just want to express my dismay at a post by the mayor on social media that boosted an account that is involved in residential school denialism and transphobia and spread misinformation about not just my involvement in a rally, but the hundreds in attendance. This social media post is divisive and has led to threats to my safety once again. That being said, and noting the date, I want to remind Council that my party did condemn the events of October 7th, and I too condemned the events of October 7th and by Hamas. And I mourn the lives lost. And I also want to condemn the ongoing bombardment and killing of civilians in Gaza, including children, journalists, and aid workers. Every life lost is a tragedy, and we must do everything to ensure peace and justice for all people in the region. Thank you.
Thank you very much. Councillor Zhou.
Yeah, thanks, Mayor. I also will have a other matter. So I'm deeply saddened to learn the passing of Sandra Wilkin a couple of weeks ago. So it's a trailblazer, dedicated public servant, a good community leader. Sandra made the history as the first Chinese Canadian woman elected to political office in BC, serving on the Vancouver City Council with distinction and compassion. She served one term in City Council from 1988 to 1990. And her election marked an important milestone in our city's journey toward inclusion and representation. I never met Sandra in person, but I heard all her story. Like Sandra, I also came to Canada as an international student. So that's an experience that deepened my appreciation for this country and the opportunities it offers. Because of our shared journey, I understand how challenging it can be for newcomers, especially those arriving from country where English is not the first language. Sandra's story reminds us that through hard working, dedication, and public service, newcomers can give back to the communities that welcome them. Beyond her time in office, Sandra also devoted her life into advancing the well-being of newcomers, families, vulnerable communities, particularly through her long and impactful work and leadership with success and other civic and multicultural organizations. She brought warmth, wisdom, and integrity to everything she did, always focused on building bridges and improving lives. Her legacy continued to inspire generations of leaders, especially women and immigrants, who will follow her footsteps in public service. I would like to extend my heartfelt condolences to her family, friends, and all who had privilege working with her together. And also, I hope that City of Vancouver could consider lowering the flag in her honor. It's a fitting tribute to a pioneer who opened doors to many people. So Sandra Wilkin's contribution will not be forgotten. Thanks, Mayor.
Thank you very much, Councillor. Okay. Any other items or inquiries or other matters? No, seeing none. May we have a motion to adjourn? Great. Councillor Montague, seconded by Councillor Dominato. All those in favor say yay. All those opposed say nay. Great. This meeting is adjourned. Thank you very much, everyone.